Okay, great. So good morning, everyone, and thank you for joining us today. Our webinar is called Medicine, Media, and Misinformation. We're really glad to have you online this morning, and we just wanted to invite we welcome your participation in today's webinar. When we call for it, my name is Jayzona Alberto, and I am a member of the Stanford Center for Continuing Medical Education. Along with my colleague Megan Morton, who is on the line, we'll be providing any technical support. If you encounter any technical issues during this webinar, we'll be happy to help you via the chat box. So please use the chat box for that. Without further ado, I wanted to introduce Jonathan Barrack. He is the Executive Director of the Stanford Health Communication Initiative, and he is also a Laurie Cross Lacob Professor at the Stanford University School of Medicine. He will be our moderator for today. And go ahead, Dr. Barrack.
Thanks, Jayzona. If you could go ahead and advance the slides, and we'll continue. So the Stanford Health Communication Initiative was established by me and my colleagues a couple of years ago, and we were fortunate to bring on board Dr. Seema Yasmin, who is one of our gifted speakers today, to help direct the program with me. We're part of the Stanford Health Communication Group and part of the Stanford Health Education Center. And I'd like to acknowledge particularly Charles Prober, who's the executive director, and Artie Porwal, who's the administrative director of that program, for their support. Next slide. The purpose and goals of our initiative are to develop improved techniques of communication for health and medical issues, to develop strategies and tools for effective communication of health information and mitigation of misinformation, and improve methods for healthcare professionals for effective communication of scientific information with the media, and to increase research and education in these essential areas. Next slide. Today, our objectives are to discuss the different categories of false health news that comprise information disorder, to recognize health information and disinformation and counter false narratives using effective communication techniques, and to translate technical language and uncertainty into language accessible to a lay audience. Next. Build relationships with the press to convey accurate, nuanced health information, discuss the publishing ecosystem, including book publishing, podcast, and written journalism, and to develop public-facing platforms as a published author and writer. Slide. We'll start today with the theory of health communication, information, and misinformation. And following presentations by our two speakers, we'll then have a skills session to provide tangible skill and guidance. Next. Our first speaker today is Rob Steiner, who is the director of the Dalai Lama Fellowship in Global Journalism at the University of Toronto, which is the first journalism program designed specifically to teach outstanding specialists on how to cover their own disciplines as global reporters. He's a Pulitzer Prize nominated finance journalist who began his career as a global finance correspondent for the Wall Street Journal. He's a former assistant vice president of the University of Toronto Strategic Communications. Slide. Our next presenter is my co-conspirator in this operation of the initiative, the director of the Stanford Healthcare Communication Initiative, who is an Emmy Award-winning health and science journalism and a finalist for the Pulitzer Prize in Breaking News. Next slide. And so, Dr. Steiner will start. Mr. Steiner will start. Please begin your presentation. Thank you very much.
Thanks so much, Dr. Barrack. Yeah, Dr. Steiner is actually my dad, who's a professor emeritus in medicine here. I'm his disappointing son who never became a doctor, but became a journalist instead. Although
give him my best regards.
Although I should note, of course, that the Del Lana School is a school of public health, and this is where we're teaching a large number of health specialists, physicians, health professionals, and health scientists how to actually function as journalists. Before I go on, I should just very quickly just acknowledge that I'm right now teaching this from the traditional territory of 3 First Nations, the Huron-Wendat, the Haudenosaunee, and the Mississauga of the New Credit First Nations. And this continues to be an important meeting place for First Nations and other peoples from across Turtle Island or North America. So let's just get into this. I would say, that's great, so we're on the right slide. I would say that even if you never write a story, even if you never pitch a story to a reporter, our experience in teaching journalism skills to physicians over most of the last decade suggests that simply seeing the world the way that a journalist sees the world, I mean a good journalist ideally sees the world, can help to create a healthier clinical culture. And that may be especially the case in a very fraught environment like the one that we're facing now, one in which people are going to naturally resist or be anxious about health information that they might be receiving. Because, you know, in our current environment, like it or not, the conditions of our environment affect the way that patients are going to hear you and the way they're going to hear health advice for 2 reasons that we're going to explore up front here. First is because the environment is very polarized. So I'll introduce a little bit about the distinct dynamics of group polarization and how seeing like a journalist can help break through that. Seema will then talk about how a polarization is actually a fertile ground for misinformation. But the second dimension that I'll then get back to after Seema presents her piece is that even if the environment were not polarized, the standard model of health emergency communications that the CDC has designed and leads, I think, are no longer really appropriate for this context. And I'm going to suggest that we move to a public health version of the patient-centered model of communications that has now become quite standard in a lot of medical and clinical environments. So let's now start by learning a bit more about group polarization. Maybe we could just move next one, actually. Great, thank you. So I think it's now pretty clear, and I'll apologize as a non-American to the other non-Americans who are on the call, that I'm going to start here when we talk about polarization in an American context. This will play out differently in different settings around the world, of course. But I think it's strongest in the United States right now. Polarization itself, I would say, is presenting itself as a public health risk. This has become quite clear in the last couple of weeks as we've seen the disease dynamics in, I'll say, you know, red states, particularly across the South. Excuse me for that. And it's, sorry, my apologies. But it was already evident in May when the Kaiser Foundation did this study and found most tellingly the bottom of this slide that there was a real breakdown in the way that Democrats and Republicans thought of masks. The question was, do you wear a protective mask every time you leave the house or most of the time that you leave the house? And a total for those 2 categories among Democrats was close to 90%. Total for both categories among Republicans at the time was below 60. My sense is that that's actually now changed, but nonetheless, it illustrates some of the problems that can arise when people aren't all on the same page. And it's tempting in this context when you're a health professional or a health researcher to just want to educate people. That, in fact, I think becomes sort of pouring fuel on a fire. If the problem were simply that people didn't understand or that people didn't have access to the information, education might work. But the facts are very available right now in how to actually manage spread in this pandemic. And it's simple enough that kids in grade school actually understand it. So it's not that people don't understand, I think, it's that some people are rejecting facts. And giving facts again and again and again into an environment like that is not only ineffective, it can actually be counterproductive. And to understand why, I want to go back to some research that was done 15 years ago. If we could advance to the next slide. Thank you. This is a study that was done by a group of social scientists and public health folks at Dartmouth in Michigan. And essentially, this was around the time of the US invasion of Iraq. They took a study population consisting of 3 groups. One were selected as opponents to the war, another were supporters of the war, and the third were sort of fence sitters on the war. And they presented a story to them in a format that would be most credible to each of them. So you can imagine, and I don't know if this was exactly the format, but opponents of the war might have read the story in a New York Times looking format. Supporters of the war might have read exactly the same story in a Fox looking format. They tried to control for the influence of the platform. The story said that the US had detected weapons of mass destruction in Iraq and that this was the reason for the war. And then they pulled them for support. And as you might guess, the opponents were opposed, the supporters were supportive, fence sitters were a bit of a mix. And then they published a correction in the same format that would have been credible to them, saying that in fact, there had been no weapons of mass destruction and that the evidence suggesting that was actually false. And they pulled them again. And they found that, as you might expect, opponents of the war were even more opposed now. Fence sitters had shifted to being a little bit more opposed. But conservatives, interestingly, the ones who actually were supportive of the war to begin with, when presented with a credible fix, a credible fact check, were actually more supportive of the war than they had been before seeing the correction. And just to be sure, they then redesigned the study and applied it in a way that would call out liberals, right? Because this is not something that is particularly conservative or liberal. This is a human way of thinking. And in the study that called out liberals, they threw up an article that quoted John Kerry as saying that George W. Bush had banned stem cell research, when in fact he hadn't banned stem cell research. He just stopped federal funding for stem cell research. Stem cell research continued in the US. They threw the correction out again in a format that would be credible to each population. And they found that liberals who'd supported Kerry were even more supportive of his position on stem cell research, having seen that what he'd said was false. So, you know, for health professionals like you, I imagine, and for journalists like me, all of us who sort of our stock in trade is facts, it is very disheartening to think that facts actually can backfire, and that when you pour facts onto a polarized conversation, it actually can widen the gap instead of bringing things together. So it's actually, if you think about it, a very intuitive human dynamic. So if we can go to the next slide, if you can imagine a sort of trivial example here. Imagine that I love muffins, I bake muffins, my mom taught me how to bake muffins, I bake them with my daughter. My friend Bernie does the same thing with cakes. Bernie and I show up, you know, before social distancing, we'd show up at brunches together. I'd bring the muffins, he'd bring the cake. We'd tease each other. He'd offer me his cake. I'd say, no, thank you. I'll have my muffins, and so on. Then one day he comes and he sort of takes me aside around the buffet table and says, you know, there was a USDA study that I saw lately that actually says cakes have more nutrients than muffins. Suddenly this has gotten a little more serious, right? And I'm like, Bernie, what are you telling me? My mom taught me how to make these. I make these with my daughter. It's our thing. Like, are you telling me that I'm actually teaching my daughter how to do something that's unhealthy? Come on, man. Just, you know, enjoy your cake if you don't want a muffin, but don't bug me about how this is a bad thing. I go away, I'm stewing about it a little bit more. I try to get beyond it, but I know there's another brunch coming up in a couple of weeks. And so I start going online. And I find a UN report, a UNICEF report that says actually cakes, all the components of most ready cake mixes are made in sweatshops. And so I bring that to me. So Bernie, you know, you told me that I'm malnourishing my daughter. Well, actually, did you know that you're employing child slave labor here? And suddenly we're now not talking about cakes and muffins anymore. We're not talking about taste anymore. Bernie is accusing me of malnourishing my daughter, and I'm accusing Bernie of being a war criminal. And we've sort of expanded way beyond what the original thing was, but we have a lot more facts, and no one's disputing the facts themselves, right? That dynamic has been around, I imagine, as long as human beings have been around. And it comes because the issue at stake here is not a function of facts. It's a function of meaning, of personal identity. I identify with muffins. Bernie identifies with cakes. And so if you assault that with facts, I'm going to get more entrenched in my sense of my meaning and my identity. Facts, whatever the facts may actually be. So if we go to the next slide, as with most human dynamics, this whole effect, which is a very natural human effect. We get polarized when we're talking about meaning and identity. This effect actually is amplified by social media. So this comes from some work that was done by Henry Timms, who at the time was the CEO of the 92nd Street Y in New York and a big social organizer and activist, and now is president of the Lincoln Center. And a colleague of his, Jeremy Hymans, who's a political organizer in Australia. And they noted that for any platform or cause, there are two types of audiences. One audience is like most of us, we'll follow them on Twitter or Instagram, we'll sign a petition, we'll show up at a rally, we might decide to vote on the basis of that issue, but that's about it. There's a small number of folks who are super participants for whom this issue is not an issue. The issue is their meaning itself. And because social media is operating 24/7, these are the folks who have the capacity and the attention to drive the discussion, right? They're the ones who wake up at 6:30 in the morning, scan the media, retweet stuff, then throw in their own thing. And by the time we're up and looking at this, we get to the office at 9 o'clock, the terms of the conversation have already been set. So in this kind of environment, if you throw facts into this, facts will actually exacerbate and intensify the sense of meaning that's going on in the debate. There will be a natural resistance. So the question then is, how do you actually break this? Well, fortunately, polarization also functions like a very predictable dance. That's its vulnerability. I say this, I know you're going to say this in response. We know all the moves. If you can break the moves, if you can throw a new move in, not a new fact alone, but a whole new framework, a new sense of meaning to which both you and the person on the opposite side of the debate may have equal access, you can actually shock the system and stop it for just long enough to remind people to think. And in this, I'm inspired partly by history, but also partly by my wife's work as a family therapist. She's running her clinic from our bedroom upstairs virtually right now. And I know from hearing about the way that she works that she'll often enter a polarized family situation. And after getting to know the family a little bit, we'll be in a position to shock this family out of its normal polarized dance by saying, have you thought of it this way? And that's just long enough to stop them from engaging in the dance, rethinking the framework with which they're approaching the issue. That's different than throwing the same facts on the fire over and over again. So if we go to slide 22, or the next slide, great, thank you. So if you can imagine, again, in the trivial example, the muffins are better than cake, cake is better than muffins. We're now totally polarized on this. But if I were to come up with a whole new framework, climate change, did you know, because I just read this, that certain kinds of flour, the flour I use in my muffins, the flour you use in your cake, is actually a major contributor to climate change? We stopped the conversation long enough for Bernie and me to get back on the same page. We're not addressing the question of whether cake or muffins are better, which one's better than the other, but we've actually stopped the dance long enough to get on the same page about something, and enough time spent on the same page enables us to return to the original disagreement with some more reason, more rationally. If we go to the next slide, a real world example of this, I think, and I'm an amateur on this history, but a real world example of this, I think, is the way that HIV/AIDS, which was, I would say, the last infectious disease to really reshape North American culture, sort of led to the inclusion over time, slowly, incompletely to be sure, but an inclusion of LGBTQIA people in a way that they hadn't been before. So if you can imagine, if you recall back sort of Stonewall time and before then, and between Stonewall in 1969 and HIV/AIDS in the 80s, the debates about whether to include LGBT people were, really about morality. LGBT people and their allies were saying it is immoral to exclude, and others were saying your sexuality is itself immoral, and there's no bridging that, right? Because it's rooted in meaning. What the original advocates around HIV/AIDS did so brilliantly was they changed the frame. They were able to use that public health crisis as a way to change the conversation itself and say, look, for the moment, let's forget about morality because lives are at stake. And what we do know now is that excluding people will actually, discrimination will cost lives. It will actually cost lives and kill people. But that inclusion has the potential to save lives. And if you think back, that is probably the beginning of the long arc towards inclusion. Obviously slow, far too slow, incomplete. But the point here is that a new framework shocked the system into rethinking about this. It broke the dance. So if we go to the next slide, we think about our current environment, right, on COVID, and I'm going to wrap up just in a second here. We've moved from a debate about, is this the flu, is this not the flu, into a slightly more heated debate about the economy versus saving lives, and into a much more polarized debate where we now see public health people resigning because they're being threatened, which is really about transitioning to greatness or killing people. Right, the two lines. If we go back to this transitioning to greatness, Donald Trump kind of line, you're killing people. Well, if you shut everything down, you're going to destroy the United States itself. It's time now. We have an opportunity to shock the system a little bit by changing the framework, and I think that this is going to depend on the population where you're working, and I'm speaking particularly here to Americans who are participating, but the same will apply to any other environment that is polarized. One perspective that I would offer is to say health includes COVID, but it's not just COVID. We can take a whole health approach that will allow us to acknowledge other people and other people's concerns, but it's not just about COVID. And I'll just wrap up here. If we can go to the next slide. Actually, one more slide. Thank you. The link to journalism is that journalism is the piece that enables depolarization, right? That vector, that breaking vector that sits in the middle there that we just saw that could break, you have to discover the ideas that are going to have the power to reframe the conversation. They have to be ideas that are counterintuitive, that are surprising enough to a wide range of people on all sides of the conversation so that they'll be shocked and stop. They have to be legitimate. They have to be fact-based, not just sort of a counterintuitive idea that you came up with over breakfast and that you want to throw out there. And they have to be urgent, equally urgent to a wide range of people on all sides of the debate. It turns out that journalism, seeing the world, and we'll get into this with our workshop, seeing the world like a journalist keys you in to exactly these kinds of ideas, allows you to introduce them into the conversation. So with that, I'll turn over to Seema. And thank you.
Thank you, Rob. Hi, everybody. I hope that you are doing well. Thank you so much for joining us. And I would also like to make the statement that I'm joining from Palo Alto here in Northern California, which is the native indigenous land of the Ohlone people. Rob's made some really compelling remarks about journalism and the role that journalism can play. And I'm going to build on this. So if we move to the next slide, I'm going to be introducing us to this concept of information disorder. And partly this is because as a health communicator, as a journalist, as a poet, perhaps mostly as a poet, words really matter. Word choices really matter. In the words of one of my favorite poets, Solmaz Sharif, it matters what you call a thing. And so you will hear me not use the term fake news or fake health news, because that term has been weaponized to demean journalists and journalism. And so I want to introduce us to language that really describes what we're dealing with. And collectively, this kind of misinformation and disinformation and other kinds of false news can be classified as information disorder. And as you'll see from the next slide, this is nothing new, whether it's jade eggs that Goop, Gwyneth Paltrow's Goop has been trying to sell us for vaginal rejuvenation, this idea of wellness being kind of stewing in non-facts and in nonsense really isn't unique to COVID-19. The next slide I've just included to show you that even in the midst of a pandemic, this was just a few days ago, we are still having to deal with all kinds of things like this. And the next slide shows yellow journalism from the 1890s. So yellow journalism really speaks to the fact that we were seeing very sensationalized, fabricated journalism more than 100 years ago. So again, this isn't new either. And yes, journalism has a role to play as the immune system of a democracy in keeping us informed, safe, and healthy. But journalism also has a history of misinforming us. And this particular cartoon shows Joseph Pulitzer on one side and William Randolph Hearst on the other. These were two newspaper publishing giants of the 1890s in a war with one another. The whole name of yellow journalism goes back to this popular cartoon of the time. But what they're warring over here is actually the Spanish-American War, which many people refer to as the first press-driven war. So not a new issue that we're dealing with by any means, even though right now many of us are just completely fed up with some of the misreporting that's happened, some of the not great journalism, and some of the conversations we're having, even with patients who are infected, who are sick with COVID-19, but who are arguing that the disease is fake. So very frustrating times. Next slide. So we have different categories of information. We have misinformation, disinformation, malinformation, and these are three different things. Misinformation is false information that's spread without the intent to cause harm. So that might be a rumor that someone shares. They may say to you, if you eat loads and loads of garlic, you won't get COVID-19. Now, that's not true. Garlic in and of itself won't protect you, but that person is spreading false information, but they're not trying to hurt you, they're actually trying to help you. Disinformation, on the other hand, is false information that's weaponized deliberately to cause harm. And we've seen this happen during previous epidemics too. Back in 2014 to 15, we saw this happen during the Ebola crisis in West Africa, where there were Russian government-linked agents, the Internet Research Agency and others that spread disinformation. They hacked into Twitter accounts of news organizations and shared things like there's an Ebola outbreak in Atlanta. That wasn't true, but it has the potential to divert emergency resources away from where they're needed, has the potential to cause an influx of patients to emergency rooms and overwhelm the healthcare system, and also just to cause panic and mayhem, which can be very dangerous. Then you have malinformation. And if we look on the next slide, we have this Venn diagram that also helps us visualize that malinformation on the right-hand side isn't actually false information. It can be accurate information, but information that's weaponized to cause harm. And this might be information that's not meant for the public domain. Maybe it's private, classified information that's shared because it's known that sharing it publicly will cause damage. And then the next slide, also from an organization called First Draft News, which is a journalism nonprofit, shows kind of this spectrum of information that we get exposed to, everything from the completely made up, complete fabrication of information through to manipulated content where there's some nuggets of truth, but it's not being shared in a way that's completely accurate, all the way down to satire and parody. Next slide. So then we see that collectively, misinformation, disinformation, malinformation, slightly different things combined we can refer to as information disorder. And why it's really useful to do this instead of using this blanket, awful term of fake news, which we've seen populist leaders, presidents use over and over again to really diminish the work of journalism. It's helpful to know of these collectively as information disorder, because then we can treat them like a disease. We can understand that actually there is transmission from person to person of information disorder. On the next slide, we can see that information disorder shares transmission characteristics with pathogens, meaning that in the same way that SARS-CoV-2 might spread from one person to another, disinformation about SARS-CoV-2 might also spread from one person to another, and then another, and another. And this is a kind of a network analysis, this kind of map you're seeing of how a virus might spread, but also how a piece of information might spread. And the next slide shows just another parallel between the transmission dynamics. And in the same way that we talk about super spreaders or super spreading events of a virus, for example, where you have one particular person who spreads the infection to many more people than the average person, you see the same thing with information. Maybe it's because it's Gwyneth Paltrow and she has many millions of Twitter followers. So if she's sharing misinformation or disinformation, it branches out far wider than perhaps if I was doing it, for example. So we see many transmission parallels between information disorder, but also between the disease itself. And the next slide just shows a differential equation that we use in mathematical modeling. So really simple mathematical modeling, the kind that you might look at to understand how far and wide a disease might spread, what the epidemic might look like in a few weeks. You can use these same models to track the spread of information, including misinformation and disinformation. And in part 2 next week, I'll talk about how we can actually use this to immunize against rumors, because there is a social psychology theory from the 1960s called Inoculation Theory, which uses a biological metaphor of looking at how we can prevent information disorder. And I think it's really useful to know that there are strategies, there are tools that we can share with you, that this is not a fight that we've already lost, although it feels really overwhelming to have to deal with so many conspiracy theories and so much misinformation at the height of a pandemic. Slide. So this gets tricky when we think about, well, of course you have false health news like misinformation and disinformation. That's just completely inaccurate. But we have to think about the potential negative impacts of us sharing accurate health information. Rob's already spoken to this in terms of facts. Just shoving facts at people can just act as a fuel. They can just cause further deterioration of the conversation. And so I want to talk about some instances where we've seen accurate health information not have the impact, not have the positive outcome that you would hope. Now, one example slide is when we think about the Ebola crisis from 2014 to 2016, the biggest Ebola epidemic we've seen in history. When I went to West Africa to report on the epidemic, I met people, especially Liberians, who said to me, well, you know, they're aid workers. They came from the UK, they came from Europe, they came from America, and they set up these Ebola treatment units. And they said to us, there's no known treatment or cure for Ebola. And at the time, that was certainly completely accurate. They were not being misinformed. But the consequence of this information was people said to me, well, when they said there's no cure or no treatment, I thought, why go to them? I'm going to go to a healer who tells me there is a cure and that there is a treatment. Next slide. There's also another issue when we think about what happened with thimerosal in the late 90s. So thimerosal, as you'll know, is a preservative that's used in vaccines to prevent bacterial contamination. It's been used for like 90 years, since 1930s. But in 1999, the CDC and some other scientific groups did some research around vaccine safety, and specifically by the time kids are a few years old, how much mercury might they have been exposed to just through their routine childhood vaccine schedule. Now, this research was done looking at methyl mercury, which is kind of what we think of when we think about environmental mercury. But thimerosal is not that. It has a 1 carbon difference. It's not methyl mercury. Thimerosal is ethyl mercury. Sounds so minor because it's just 1 atom difference, but it makes a difference biologically because ethyl mercury is excreted from our bodies much quicker and it doesn't accumulate in the body as much. So based on evidence on methyl mercury, on environmental mercury, in July of 1999, the CDC decided that it would call for all thimerosal to be removed from childhood vaccines. And the CDC said that it would like doctors to delay the birth dose of the hepatitis B vaccine from kids that they deemed to be low risk. And then the next slide shows a statement that the American Academy of Pediatrics issued in 1999. They said, parents should not worry about the safety of vaccines. The current levels of thimerosal will not hurt children, but reducing those levels will make safe vaccines even safer. While our current immunization strategies are safe, we have an opportunity to increase the margin of safety. I think I count about 4 safes or safeties in there. That statement to me is confusing. And if we look at the next slide, we see what impact this had. This recommendation to remove thimerosal and to delay the birth dose of HPV vaccine meant doctors were confused. It wasn't just me. 10% of American hospitals suspended HPV vaccines for all newborns, regardless of their risk level. And I found just in the literature at least 1 death of a baby in Michigan who died because of that. Parents were really alarmed by the policy change because they were like, wait, if you're saying thimerosal is safe, then why are you suddenly in a rush to remove it? There's a New England Journal editorial that says that parents' faith in the vaccine infrastructure was shaken. And I think it's understandable that that would happen. But also the following year and onwards, we saw advocacy groups that were established based on this singular belief that thimerosal for decades had been causing autism in children. So this was the fallout of this communication that was, we think thimerosal is safe, but just to make things safer, we're gonna remove it. And I share this to think about how complex it can be, even when we're in the domain of accurate, evidence-based information. Next slide. I want to peel back the curtain a little bit on some of the processes behind science journalism. I trained as a physician, then I did my fellowship in epidemiology, and then I went to train in journalism under Rob's tutelage. And Rob will talk after I've wrapped up about how a new journalism framework can heal a polarized health communications environment. And I very much believe that. But next slide, I think it's useful for us to also understand how it is that as physicians, we end up reading reporting that makes us want to throw the newspaper on the floor or turn the radio off. And we're like, how does this even happen? How could it be that journalism might actually contribute to a polarized environment? Next slide. Some of the ways that this happens, and I saw this happen so much early in the pandemic, and I've been doing trainings like this one, but focused entirely on science journalists, is that when you're looking for sources, people who are credible, who know the facts, who you want to get information from, sometimes the loudest voices, the people who make themselves most accessible, the people who speak in sound bites, are not the most expert sources. They're people who speak broadly outside of their area of expertise. They're people who don't do the annoying thing that scientists do. You know, scientists were always like, well, yes, vaccines are safe, but there's always the risk of adverse events, right? It's easier to find people who might speak like, oh, vaccines are always unsafe. And that can make for sometimes easier storytelling for journalists, and it can be a trap that many fall into. There's also the issue of all sources looking the same. They're all men, they're all cis heterosexual men, they're all white, they all come from the West. And that can completely narrow the way that you are telling stories and the perspective that you're offering to your readers. False equivalence, unfortunately, still happens. That's the problem, where you show two sides of an argument as being equally weighted. And it infuriates me that it still happens. Sometimes I still get invited to speak on panels about vaccine safety, and then at the last minute I'm told, oh, and just to balance things out, we're going to have this guy who believes that vaccines are unsafe and believes that people should not. And I'm like, no, there is no room for that debate right now. And of course, there's the fact that we operate not in a bubble. Scientists love to think that they're neutral and apolitical. That's utter BS. We bring our own implicit and explicit biases into the laboratory. When Rob talks about facts, we also have to question who produced those facts. What was the process through which those facts were produced? We know, for example, that syphilis causes a specific set of signs and symptoms. It's how I know how to look at someone's hands or feet and look for lesions that indicate that infection. However, some of how we learned about the natural progression of syphilis is from Western doctors infecting people in Guatemala, including children, including prisoners, including sex workers, leaving them untreated so that we could learn what untreated syphilis looks like. So when we talk about facts, in my mind, I'm always thinking, where did those facts come from? And of course, you have anti-science groups who are acutely aware of the distrust in particular vulnerable communities, and who really weaponize that, really use that to fuel their messaging. Whereas in science, we just like to pretend that none of that happened. There was no history of unethical experimentation. Next slide. Really quickly, because we haven't got some time and we've got so much to go through, I just want to peel back the curtain a tiny bit and just put you in the middle of a newsroom during the early days of a pandemic. This is an Italian newspaper who on March 7th received a leaked memo. The memo was only meant for regional officials across Italy to find out what they thought about a regional quarantine in the north of the country. So I just want you to imagine for a moment that you're a reporter having a conversation with your editor and you're thinking, do we publish this leaked memo that could impact the lives of 16 million people? Do we hit publish today and let 16 million people know that tomorrow there could be a quarantine? So I don't know what you would do, but on the next slide, and this is the region that was affected. Next. Next. So the story was published, and on the next few slides, we can see the impact of that. And on the next slide too, was that there were thousands of people who saw that leaked memo in their newspaper and thought, oh my gosh, I am getting out of this area before it goes into lockdown. And thousands fled the region, flocking in crowds in ways that you don't want people to be in close proximity to each other, packed onto train station platforms like that. And of course, the implications of that was that the next day, Italy reported its highest day-on-day rise in deaths from COVID-19. It's hard sometimes to connect one outcome to one particular event, but certainly we feel that this may have played into it. Next slide. We talk about a free press being the immune system of a democracy, and very much it can be. Journalists, when they are well supported, when they are well trained, can counter false narratives, disseminate accurate information, and hold the powerful to account. And we so need that. But my final slide shows that, unfortunately, at the height of a pandemic, what we've seen is close to 40,000, maybe more now, because this article was a week or two ago. We've seen tens of thousands of journalists just in the US be furloughed, lose their jobs, or have pay cuts right when we need them, right when we need people doing great accountability journalism. We've seen journalists in India be threatened, be physically threatened because of their reporting on the government response to the pandemic. So I'm going to hand back to Rob now, who's going to talk more about a patient-centered approach to communication.
Great, thank you, Seema. That was awesome. It's I'll start just by saying there's like no greater pride that than a teacher being able to co-teach with a former student. It's and frankly learn from a former student. So thanks for that. I want to pick up just on one very quick thing, which I think will be a good bridge into the workshop stuff we'll do after the break. I'm constantly sort of amazed and inspired by the rigor with which journalists are actually approaching this story. One of the challenges and one of the breakdowns is, and it's something to be aware of, particularly if you are a health administrator, if you're in a senior position at a health institution, is that a lot of people who could help journalists understand the nuance of this are being told by their institutions, in particular their hospitals, if they're employees, not to speak. And that actually really, that contributes to the dissonance, the broken telephone, and some of the problems that Seema was talking about. So we'll park that for a second, and we'll get into this. The final piece in terms of sort of setting the scene, for the value of journalism thinking in this context, is something that's actually not connected to polarization, I would say. So Canada is actually an interesting vantage point for this, because the comparison between Canada and the United States, and the same may be true for other countries whose folks are attending on the call, I would make an interesting observational study of pandemic communications. What does the communications environment in this kind of extended pandemic look like when you control for polarization, if you will, right? So in Canada, we have a lot of other problems, but the COVID conversation itself is not polarized here, remarkably. We're really all on the same page about this. And yet we have some very serious communications problems up here, with the exception, I would say, of British Columbia, which is an amazing story in and of itself. And I'm happy to sort of answer questions as best I can on that when we get to Q&A. But the problems that we see here when you control for polarization are very similar to the problems that are existing in the US and I think elsewhere in the world, and are now increasingly evident in the last few days. When you think of the stories about public health officials who are resigning because of the physical threats that they're receiving from people. And I think that this stems from a rigid adherence to a CDC Communications Protocol that is, in my mind, spectacularly unsuitable for this kind of situation. Great, so we're on the right slide, thank you. So CDC has a set of protocols. Seema, who worked at CDC, would be very familiar with this. They're called CERC, CERC, I'm not sure how you pronounce it. And it's pretty straightforward. Canada, I was involved in the creation of the Public Health Agency of Canada up here immediately after SARS, and in the political advice to our Prime Minister at the time. And we just adopted this lock, stock, and barrel because it works in acute situations with a known risk or a known pathogen that is affecting a specific population over a very specific period of time. So imagine an earthquake or a flood, or a disease outbreak with a known pathogen like an influenza variant or Legionnaire's disease, something that is affecting a specific population. And there are some basic principles here from the CDC's playbook. First is that public health is in the lead of the conversation, right? You don't have politicians talking about the health emergency. You have public health officials talking about the health emergency. And you don't have health professionals who aren't public health talking about it. Second, that the public health folks provide information. They generate support for the response that they have designed, very importantly, that they correct the kind of misinformation that Seema has pointed out and described, which is, I think, endemic, to use that that term in any chaotic environment. And they explain their recommendations. This is a command and control protocol. And basically it says, everyone shut up and listen to what we are saying to you. We will listen to you just enough to understand how you are misunderstanding us, and we'll respond to that. But basically, we're in charge, pay attention. It is the public health equivalent of brace, brace when the plane is going down, and it's exactly the right thing to do when you're in a very contained environment with a known set of risks. I would say that this, back in February and March, that's sort of what this felt like. We felt inaccurately that we knew a lot more than we actually did. I think partly because the case reports coming out of China made it seem that this was a pretty cut and dry kind of virus where we understood, we're starting to understand how it presented, and we understood the populations it affected. There was very little nuance, as I understand it, in the case reports coming out. So it felt like that, but in fact, our situation is very different, particularly now. First of all, it's not a specific acute crisis. It's incredibly wide-ranging. Right? It is affecting everything. And when you take a whole health perspective, it's affecting everything. So in a clinical environment, we might say that there are tons of complexities. There are tons of comorbidities affecting whole health outcomes for the population, from mental health to social cohesion, to social determinants of health, to intimate partner violence. So public health alone is not enough actually to lead the communications here. And when they're the only ones in the lead, we're missing an ability to answer all sorts of equally important questions. When other health folks aren't at the table, politicians will step in. What do we do about the economy? What do we do about rampant opioid addiction that's sort of resurging? Politicians will step in with their answers then. The other thing is that this is now, I don't know if it's officially endemic. I don't know what the measures of an endemic disease are, but it's certainly around here for a long time. So unlike an outbreak of a discrete disease in a specific environment, this one is going to be lasting for a long time. As a clinician, you might, if you're looking at an individual patient, call this chronic. So we're now out of the heart attack and we're into the chronic heart disease stage of this. Third is, it's not known. We actually don't know. We still don't know a lot about the virus, about how it presents, about what its long-term effects are, about the populations that it affects, about how it interacts with other health factors. And finally, the population is discovering things about this disease before public health folks are and before the labs are, right? So there's knowledge that's emerging from all over the place on this. So the command and control system actually not only is breaking down, but it's not actually very credible for people who are simply being told, how to behave as if the folks at public health or the CDC or the state health board or whatever it might actually be, or the random infectious disease specialist who wants to make himself available or herself available to every newspaper who calls them, these folks are not as credible as they would be in an acute environment. And it's producing, and the authority with which they're speaking is actually producing a reaction and resistance. So it turns out that clinical medicine and clinical healthcare figured out how to work in a context like this a long time ago, like 20 years ago, right? That's patient-centered care. And I would suggest that public health begin to consider the same model of communications for an extended epidemic or an extended pandemic with an unknown or novel pathogen like this one. But how would you approach a population as if it were a patient? What is the conversation, right? Patient-centered care depends on a two-way conversation between the health team, which by the way is not just the physician. If you consider my dad's old field, endocrinology and diabetology, it's not just the endocrinologist, it's the nurse educators, the dietitian, and maybe the social worker, maybe the psychologist. How do you actually plot the conversation between the broader health team on a pandemic and the population as if the population were actually a patient? Well, it turns out, in my mind anyway, that journalism offers a set of tools for that as well. So great, we're on the right slide here. No, sorry, if we can go back. Excellent. So on the left side of this, you'll see the basic principles of patient-centered care. This comes out of the sort of landmark paper from 2000 that's widely cited as having set these principles. And there are at least 5. First, taking a whole view of the patient, seeing the patient beyond a single disease, a biopsychosocial view of the patient, right? Journalism does the same thing. When you see things like a journalist, you are naturally, instinctively breaking silos, right? Journalists actually bridge silos from one to another and look for interactions and the opportunity for synthesis and integration that people operating in their silos don't see. That's how a journalist thinks. Second is that the patient-centered care model understands the patient as a person, right? Understands that different patients will attribute different meanings to the disease that they may be facing. For some, it is the end of the world. For others, it might actually be a relief. Finally, I have a diagnosis. Whatever it may be, that you approach it from the context of meaning that the patient actually has. That's what makes it an art, right? Journalism, similarly, is a discipline of witness bearing. And what the two things have in common is approaching this with a rigorously open mind. So that if people are coming into my clinic saying, I just don't believe in this mask crap, why? What meaning does that mask have for you, right? And if you're approaching at a population level, what meaning does wearing a mask have for the parts of the population that don't actually want to carry it? That's a journalistic kind of question. It enables a therapeutic alliance, right? Because now I don't necessarily agree with you, but I can have some empathy for you and I can understand where you're coming from and communicate with you on that basis. Patient-centered care shares power and responsibility, right? And patient-centered care also treats the health professional as a person, right? Recognizing that that health professional, that physician is not God. That health professional has to be able to say, I don't know, without diminishing their own authority or their own sense of their role in the relationship, right? Journalism does the same thing. Journalism, and here we get back to the original point that we were talking about before. A journalism way of seeing things challenges ideology by noticing evidence that does not fit into the conventional wisdom, by assessing that evidence skeptically and by entrusting the public with the results. So I'm not going to go, we're just at the end of time here. The last few slides here, which I think you'll have, I assume that they're being shared. Maybe we can go just right to the very last one. We've been teaching these methods to physicians for the last decade. Sorry, could we just go to one slide before that, Gisona? Thank you. To physicians, among other subject matter specialists. Seema was one of the first group of physicians who were actually in our program in 2013-14. And last year we studied 22 MDs who had taken our program and asked them how the skills that they'd learned affected their clinical experience, their clinical behaviors. It was a pretty wide-ranging study. These are only some selected findings. But you start to see already that even for the ones who were not active as journalists, right? Seema's very active. She's sort of a bit of an outlier. There are a lot of others who will write or report 2 or 3 things a year. But whether you're active or not as a journalist, journalism thinking and seeing actually on these dimensions at least gives you the opportunity to create a healthier clinical environment when it is otherwise fraught. And that, I think, is the context that we're sitting in now. So I'll stop there and turn it back, I suppose, to Jonathan or to Q&A. Thank you.
Yes, thank you, Rob, and thank you, Seema. Those were outstanding presentations, a lot of great information. We've got about 15 minutes for Q&A, and we're going to start off with a question, but while you're thinking about it, if you have questions, please go to the Q&A function and type them in, and we'll do our best to get through as many as possible. So the first question, Seema, perhaps you can start by answering this. How do you explain the faster traveling of false information?
Yeah, so this has been studied, and what we think is that it's novelty that drives the spread of falsity. And a lot of this understanding comes quite recently from an MIT study, which was the one that established that false news seems to travel faster and farther than accurate information, which is kind of infuriating. But when you look at why that is, it seems to be that it's because false information seems novel. It's often something that others aren't saying. And so people then share that because it makes them appear to be in the know. Look, I know this thing that other people aren't saying. Other people aren't saying it because it's not true. But the other thing that happens is false information is also much more likely to be an emotional trigger. For example, false information might be more sensational. It will use even words like disgusting or scandal or hate, things like that. when we see those as humans, we have a response that kind of makes us think, oh my gosh, this is awful. And then if you're not fact checking things, if you're not doing your due diligence, you're likely to spread that. So it's a lot to do with the novelty of false information, how that causes emotional responses and that element of surprise. And if you're interested, and I can put in the chat a really interesting study from 2013 that looked specifically at tweets that were shared around the Boston bombing, the marathon bombing, because that was where researchers started to understand why it was that false information might travel faster and farther, why we might be more likely to retweet and share things that actually didn't even have a nugget of truth in them.
If I might just
Please, Rob, go ahead.
Just one quick point there. The novelty piece is really key, right? Because good journalism, and we'll get into this when we do the skills workshop, good journalism is novel. It is counterintuitive. It's surprising. Mm-hmm. The problem, of course, is that finding the counterintuitive, surprising thing, that making sure that it's substantive takes time. Mm-hmm. So journalists do work fast, but we don't work as fast as someone who just can make something up. Ideally, the novel stuff that we find as journalists has impact that is sustainable and lasts and is a little bit less ephemeral than a made-up story. But novelty is a key thing we'll be talking about. Responsible novelty, I would say.
Mm-hmm. Next question is, why is there a media bias for the middle balance when sometimes there aren't two sides to a debate? How do we engage effectively with that bias as scientists trying to communicate health information? Who wants to start with that?
Rob, do you want to? Could maybe expand on just what I mentioned on false equivalence?
Yeah. So yes, it's a problem. I think it's actually less of a problem than we think on key things. So for instance, I think we've moved on climate change, right? Which I know this is not the topic we're talking about, but that's often the example that comes up, that you will have a climate change person and then a climate denier. And people when I give talks, people keep bringing that up as a conversation. And I can't remember the last time I saw a climate denier quoted as an authoritative figure in a meaningful news organization. Sorry, Seema, yeah, you say
that, Rob, but just 2 days ago on BBC Radio 4, I heard this really academic discussion about, is Britain systemically racist? And there were 3 academics arguing that it wasn't. And that to me felt like false equivalence, because over the last 3 decades, we've had multiple official reports in the UK saying that our systems, including policing, are systemically racist. And I was like, why are we having, this is such a waste of my time. Why are we having this weak debate? So maybe it happens less, but there are some issues, maybe racism, sometimes climate change, maybe vaccines, where it does just keep happening.
Yep. So what I was going to add actually is that sometimes we think that science is science, that there's a single truth that comes out from science or that comes out from social science in the case of systemic racism, right? That there's a single truth and we all need to adhere to that, right? And the truth, as the folks on this call know, because they're scientists, or at least science-based in their work, is that science actually doesn't operate that way, right? There are honest debates in science and in social science. And so I didn't hear that conversation in BBC4. It may have been simple. So I'm not surprised that people would argue with the notion of systemic racism, because there are a lot of folks who are just encountering this for the first time. So it's an important mark of where we are in the conversation. But the other thing is that it might actually be a sloppy way of phrasing an important disagreement. How do we define systemic racism? I'm not saying that was the case in this conversation, right? When scientists actually speak as if they are representing God's honest and final truth, journalists who are also really smart, we went to the same universities, we're also smart. We're like, really? There's no one else who thinks any different? That's my first question, right? When a paper comes out in the New England Journal, as if it were, and people treat that as God's honest final truth. Smart journalists are like, I don't think so. I think that's a paper in the New England Journal of Medicine. So I'd like to find some other folks who will tell me whether this resonates or not with them. That then can lead you into folks who are just denying the whole paradigm. And that can be dangerous. But I think it's also incumbent on people who are knowledgeable to recognize that, that no single scientist has a whole grasp of the truth, and that there's nuance on the edges of everything, and that science progresses slowly and by increments. And if you can engage a journalist in that and say, to be sure, all we did was study this, we didn't study all that. So, and there's going to be disputes about this, then you could sort of inoculate that risk a little bit and direct the journalist to the responsible discussion and not to an irresponsible discussion.
I have a couple of practical questions. If we take an empathetic response to mask rejectors, how might this lead to change in behavior?
Mass rejectors, like people who are rejecting.
Using masks.
Oh, masks. So I
Masks.
thought you meant mass as in MASS.
No, masks.
Rob, what's your take on that?
I'd start by, and here I really have to give more credit to my wife, the psychotherapist, who educates me nightly at the dinner table about this than to my own journalism training, but I've seen it bear true there. If you demonize folks, if you say, you know, you're just stupid, they're just going to stop listening to you. We had an incident here. It wasn't a mask rejection thing. It was a social distancing rejection thing. We had an incident here on one of the first nice days in the spring when a whole bunch of people showed up at one of the more popular parks in Toronto, Trinity Bellwoods, if there are any Canadians on the line. And our medical officer of health, who had been doing a solid job, not a great communicator, but a solid job, certainly on the science of it, doing a very good job, she must have been at her wit's end. And she just came out and she said, this was stupid and selfish. And as someone who understands the temptation to go into a park on that day after having been cooped up for 3 months, my reaction was, you've just invited us, Dr. Davila, to not listen to you anymore. Because you don't understand why we went into that park. I didn't go into the park, but you don't understand why those people went, because they're living in apartments, they don't have backyards, because they actually need to see friends they haven't seen in 3.5 months. So I can acknowledge why you are doing something. Then I can actually put the need to do this thing in a context that might make sense to you. I know you need to get into a park. There are 7 other parks right near Trinity Bellwoods. I'm not going to tell you not to go into a park. Just go to Christie Pitts, not Trinity Bellwoods, right? I understand you need to see your friends. So see them somewhere else. Don't see them there. And that's actually exactly what Bonnie Henry, the Chief Medical Officer of Health in British Columbia, did when she faced a similar situation. And people listened because they're like, you know what? You get me. You're not insulting me. You accept that I'm smart. You accept that my motivations are genuine and meaningful, and you're trying to put it in a context that shows me that you understand who I am. And now I'm prepared to listen.
Here's a question. Which impact do you think the role of the scientists, the expert scientists, plays in establishing trust, and how do they do that?
I think it can play a big role. And when we look historically, the public has high levels of trust in scientists. I also think, though, about the Andrew Wakefields of the world and other people who have credentials, you know, similar to mine, who fomented distrust by doing unethical studies that really fueled the anti-vaccine movement. So I think scientists have a critical role to play in truth telling, but I think 2 things happen. One, sometimes we can be silenced by our institutions who don't want us to truth tell. And the second thing is we can act, like I mentioned earlier, as if we operate in an apolitical, ahistorical, neutral bubble, and that's just not true. And I think as scientists, we do have to speak to history. We have to speak to why it is that now Black and brown communities might be quite upset that people are talking about testing a novel COVID-19 vaccine in their communities. Public health experts will say, but that makes sense. It's higher transmission. You're more likely to die. But no, that can really trigger alarm bells if you're from a community that's had awful history with public health officials and with doctors. So I think trust is a process. I think it's something you build. I think it's something that takes time and a really deliberate nature, as opposed to, I am Mrs. Scientist and I have these skills and I have the facts and I am neutral, therefore you must listen to me. It was exactly that kind of attitude that made me go into medical journalism after being a doctor, because of that disconnect between the people we're supposed to serve and the medical establishment. We so often don't represent the communities we're supposed to serve, right? So we're kind of outside of that history. I even think about that recent TB outbreak in Alabama, where it was a couple of years ago. It was one of the worst tuberculosis outbreaks in America in recent history. It was terrible. The rates were really high. And when people were like, we don't understand, the people in this region of Alabama, they're not coming to get tested. We're even offering them cash. We're saying, we'll do it for free and we'll give you money to get a TB test, but no one's coming. And I think, just look at Google Maps. It's an hour drive from Tuskegee. And, you know, that awful study of untreated syphilis in Black people didn't end until like the mid-70s or so. So there's a legacy there. We can't pretend that we just come in as these neutral actors.
I'm going to combine a couple questions because we only have a couple more minutes left before the break. And then for those of you whose questions we don't get to, we'll try to at least type out answers after the fact. So we'll answer all the questions later. So this is a kind of a general question. How do you break the chain of false information, especially when it's already gone viral? And combined with, do you think that social media can be used as a tool to communicate and mitigate this problem and communicate research.
Rob, do you want to go?
Well, you seem to have. I'm actually looking forward to your answer on the math after the break. But let me start on the second part of that about social media. Yes, I would say yes and no. Yes, social media. You know what? I think one of the principles here is that if you, to whatever degree you can, flood the zone with good information, you drive out the oxygen that bad information can take. I don't know the math behind that, and I see that Seema is looking skeptical.
Well,
So
doesn't that go counter to what you said earlier about pouring facts onto a conversation, or not? Do you feel like that's not analogous when it comes to social media?
No. I think that I think at the basis, if you have more facts in the environment, that is better. But I think that alone can, if you don't add that new framework, right? If we're talking about misinformation, it's better to have more good information. If we're talking about depolarizing, I would say that's not enough. Simply broadcasting facts. What I was also going to say, though, about social media, which I think is more on my mind, is that social media have also been misused by, I would call it sort of arrogant science. The whole thing of the whole model of preprints, right? That I can take something that has not been peer reviewed with crappy study design, with N equals like 8 guys who I knew down at the clinic, who haven't been randomized, right? Now I'm going to throw that out as if there were a study, because ostensibly I want to help science along, but actually quietly because I really want to get my name out there for my research. That's bad, man. Science by press release, the remdesivir press release with no study behind it. And then when the study comes out, we find out that they changed the endpoints in the middle of the study. That's bad. So I would say social media, it's not a cure-all, but it's a place to participate responsibly. But Seema will have a stronger sense of this.
We will talk more about this later today, but also next week as well. Now, I think there's definitely, and part of why we're doing this is because we want you to be able to have the tools to leverage platforms like social media. And I see some physicians and scientists out there doing it so expertly, and I can share some of their handles with you if you want to see social media expert physicians and scientists in action.
Well, thank you very much for handling all the questions with great answers. We have a bunch of other questions, of course, that are in the queue, and we'll try to get to them later. And if we miss out on any of them, we'll be sure to answer them in writing. So welcome back to the skills workshop part. We're going to do a session on pitching, reporting, and writing. And I think we're starting off with Seema, is that correct? Or is it Rob?
We'll start off with Rob, but I just wanted to explain for the skills workshop, we want this to be really hands-on and useful to you. So Rob and I will go back and forth in a dialogue talking about 3 key journalism skills: pitching, reporting, and writing. We'll talk about how these are relevant to those of you who signed up to this webinar because you want to write op-eds, you want to have a podcast, you want to blog. Some of you have told me you want to write books and you want more information about that. But then I know some of you want to also learn about how these communication skills are useful to you in your day-to-day clinical work, in your work writing grants, in your work explaining what your scientific work is about. So as Rob and I go back and forth on each of these 3 key communication skills, we'll be actively monitoring the Q&A to respond to any questions you have. We're also going to leave you a few minutes within each section, each of those 3 sections, to work on particular projects or write a few sentences about how you might apply this to your day-to-day work. So I'll hand over to Rob to start, and then you'll hear from me in a little while.
That's great. And I just thought, Seema, but I'll do this in live time, that we might go from the pitching stuff, what makes a great story, right into structures, and then about how to find more stories and things like that. But you'll see my cues as we go, if that's okay. Really
sounds good.
Awesome. So thank you. So let me take a step back. This is basically how we teach journalism in our program. And my goal here, again, is to help those of you who actually want to do this to have some basic tools by the time you're done today's session. And those of you who don't want to do this or can't see your way to doing but are sort of interested in journalism, this will both tell you how we journalists work, but will also, I hope, be able to map on in some ways into your daily work with your patients or in your community. So I think of journalism as having basically 4 key skills. One is on the sort of outside wrapper of this scheme. is what I would call a beat, basically having an area that you are watching more carefully than others. It's very, if we don't pick an area that we're watching, then we're starting to do the kinds of things that Asim was talking about, where experts are speaking, contributing to the conversation outside of their areas of expertise. I've seen this a lot in the last little while. Mathematicians who know how to, know differential equations, starting to talk about virus spread, microbiologists starting to talk about math, and that kind of thing. If you pick an area that that you follow, where you can actually even get outside of your own ideas that you already have because you know who to read every day, that's actually the first step, I would say. We know that doctors aren't doctors, but we all have our piece of the universe that we're watching. So I think it's important to know where you are. Half of the battle here in terms of breaking through into the public discussion, I would say, is having a great idea. And an idea, we'll talk about the criteria in a minute, but and that is where we get all the leverage. If you have no other skills, if you can't write clearly, if you are able to come up with a robust idea, that in and of itself will convince an editor or a reporter or some other gatekeeper of the public discussion that they should be listening to and pay attention to you. And then they might actually execute the work with your help. But it's key to have a really good idea that's going to break through. And we'll talk about those criteria in a second. And then we get into a couple of things that are more, I would say, traditionally taught in a journalism school. Those first two are not traditionally taught in a journalism school. The assumption in a J school traditionally is that you come, someone else will give you the story ideas, and then you'll just execute it. And then one day when you're, much more mature, you'll come up with your own. That's not the way this world works anymore, and certainly not for people who have a contribution to make like yours. But the two other skills are knowing how to get out of your own head on an idea and discover even things you think you know well, discover more on them by reporting, which is not unlike the basic ethos of science, or diagnosis, and finally just sort of some straightforward writing structure. So if we go to the next slide, if we go in one more slide, thanks. We'll start with this. The reason it's really important to actually pitch an idea first, right? So let me take a step back. Academic journals and op-ed pages want you to write a whole story before they'll even look at it. The news section, if you're trying to pitch an actual story, will actually want a pitch. And the reason that op-ed sections and journal articles want to see the whole thing is because everyone has an idea. So they actually want to see if your idea hangs together. But it's important either way, whether you're proposing an op-ed or whether you're proposing an op-ed or a commentary for an academic journal or a news story, right? And the difference, we can address the difference if it's not clear in the Q&A. But the difference is basically, are you sharing your own opinion, or are you actually bringing us something that you've discovered out there outside of your own knowledge or experience? But whatever you're doing, it's important to think of how you would pitch this first, even if the pitch doesn't go to anyone. The reason is that ultimately, if you're putting this into the public conversation, you are only one party in this. You have to also be thinking very much how it's going to be read, who is actually interested in it, why they're interested in it, what information you need to bring to them, what they've already learned, is this surprising to them, all sorts of dimensions that will help you know how to break through into that conversation. So the pitch is basically just like, it would be if you were in business, right? It's like an elevator pitch. It's a very brief way of thinking of this as sort of 150 words that answer some critical questions. And if you are never sending the pitch anywhere, even if you are writing a commentary for which they want to see the final product, the final draft, holus bolus, the pitch will actually force you to reckon with what you actually want to write about and say, and how it will interact with the community out there, if you're actually pitching something to them that they need to know that they don't yet know. So if we go to the next slide. This is, I sort of hang my entire program, all the programs I teach, in effect, my entire academic career on this one slide. These are what I would say the sort of 6 criteria of an idea that is going to have impact with an editor, but the editor is really only the surrogate for the public, right? And the reason we think of the editors is they're obviously the gatekeeper to the public conversation. But the same would be true if you were trying to appeal to, the chief of staff of a governor or, the head of a foundation. This comes basically out of the intuition that I was taught at the Wall Street Journal when I was a foreign correspondent there. And although I was covering finance, I was really functioning much more as a foreign correspondent. And this is how we had to pitch all of our stories to New York. We could not do a story from Tokyo or Hong Kong, where I was for years, unless we pitched it first and unless New York or Hong Kong, our regional headquarters, said, go ahead with that. That sounds interesting. So there are 6 criteria here, which I would say the first 3 are really critical. And then when I'm done with those, I'm going to turn over to Seema for her experience with this. And she may have moved entirely into a whole different way of thinking about this stuff. But here are the 6 criteria I look for as an editor. First, tell me why the story that you are thinking of is important, not just to you, but to the actual audience that you're targeting, right? So you have to actually start by thinking about the specific audience you're targeting. And if it's Americans or Brazilians or South Africans, that's probably too broad. So think of the particular audience you're targeting. Is it a specific community? Is it a specific profession? Is it a specific gender? Is it whatever that may be? And which medium is actually serving it? What platform is serving it? And why is your thing, your insight important, not just interesting, but actually important to them? If I can read one thing today, why is this the thing I need to read? That actually leads to what journalists will call the nut graph, the significance, and it's the question you'll hear editors ask all the time. Why do I need to know this? There's so much out there. Why do I need to know this? Second, I think equally important now, although it's interesting that this has shifted in the last 6 or 7 years, equally important is, why is this counterintuitive? You heard Seema talk earlier about this sort of disease dynamics, if you will, of, I won't call it fake news, but pathological information, misinformation, malinformation. Like, why is that stuff spread so quickly?
Information disorder.
Information disorder, thank you. Why does that stuff spread so quickly? Because it's novel, right? This stuff, the most powerful real ideas, right, or ideas that are relevant or that are accurately reported, spread also because they are counterintuitive. It is the thing that you want to tell your wife, husband, girlfriend, boyfriend, son, daughter, whatever, at the dinner table that night. Oh my God, did you know this? Blank. So if it is obvious, it won't be attractive. If it's counterintuitive, responsibly counterintuitive, then it will be interesting. Is there tension in the story? This actually touches on one of the questions we had in the first session about why is there a need for this false, what drives this false equivalence in journalism? Well, journalism actually, this was not part of my answer, but it should have been part of my answer. There's a serious and I think very legitimate recognition among serious journalists that nothing is static. Everything is changing. The world is not a Wikipedia entry. The world is not an Encyclopedia Britannica entry, the stuff I have right behind me, which, I got this in 1983 and it hasn't changed since then. That's not the world. Even Wikipedia entries aren't locked. So the real question is, what's actually changing about this? What is the latest? What's being challenged? What is the dynamic, right? So often I see scientists and various other subject matter experts present something, again, as if it were bang, solid, the truth, inalterable. We know that's not the case. So tell us what's new and what's changing here. And that leads to, that's really important, because recognizing what's changing, first of all, it raises the tension, which makes something attractive to us in a responsible way. But it also acknowledges the intelligence of the audience, right? Don't tell me something, as if it had always been true and it'll always be true, when I know every day that stuff is changing in my work and your work and everyone's world, right? Fourth, and it connects to number 3, why is this timely now? So not only why do I need to know this insight? Why is this insight important? Question number 1. But why can I not put off reading about this or hearing about this until, August? I have time today I used to say this, but none of us are riding public transit anymore. Probably I say, I have time on my subway. I have 4 stops. My phone has just gone out. I'm locked on a screen. Why am I reading this story and not 5 other stories before I get to Division Street, as my Chicago-born editor used to say? So why is this timely now? Final couple of things. Make this substantive. And this is our big opportunity to distinguish ourselves from misinformation. uh, uh, or disinformation. What examples, what hard evidence do I have to show that this insight, this counterintuitive insight that you've not heard before is actually real, and show me that this stuff hangs together? And where has this been? And then finally, when you're actually pitching someone, you want to show them, you just want to make sure that they've not already covered the story. We've had so many experiences where our folks come up with a great thing, hits all of those 5 things. I get very excited about it. We pitch it to a place like the Boston Globe, and the Boston Globe says, yeah, if you'd bothered to look at us, and I know we're behind a paywall, so now I know that you don't even pay for my product. If you'd bothered to look at us, you would have seen that we've reported on this 5 times. It's a great way to burn bridges. But I would say of all these, the first 3 are the key ones. And if you ever need to know, how an individual organization thinks of its news and of the information that it's getting, a lot of places that are driven by contributors or freelancers will actually have contributor guidelines sitting right there on the website. So I'll turn over to Seema. Your thoughts? I don't know if any of this made it in the real world as you've gone on.
The way that I teach pitching is that it's all about caring. Why do you care about this story, and how do you make someone else care? First, the gatekeeper, for example, an editor, and then second, millions of readers. And this is completely applicable to the newsroom, but also to the clinic, to your workplace, because you're trying to think about pitching as a way to make somebody else give a damn about a particular topic or a particular issue. Rob mentions the 6 criteria of a great story idea, and I've kind of taken his, I teach health journalism now at Stanford, and I've taken his criteria and merged them with what are known as focusing questions from my former editor, Tom Wong at the Dallas Morning News. And so what my students have to do before they do a deep dive into some meaty, juicy science or health journalism story is they have to answer a series of questions before they can get to writing. And these questions include, and these are very similar, if not the same, why does the story matter? What's the point? Why is the story being told? What does the story say about life, the world, the times we live in? What's my story really about in one word? That's a hard question. What's the glimpse of wisdom we can offer? How do we bring something new to this story? These can be tricky questions. They can trip you up a little bit because, for example, what can happen is a student or a reporter is like, I really care about homelessness. Homelessness is a terrible issue. I want to write a story about homelessness. And you're like, okay, it is an important issue. What's the story? Why would you, what's the angle? What's the news hook to that? Why would we tell that particular story now? So yes, we care so much about these issues. Those of us who are working in the field of public health and who care for patients, we care about the conspiracy theories that they're exposed to. We care about the fact that they might not follow guidance about wearing masks or physical distancing. We care about the fact that they say to us, I know people are working on a potentially pandemic ending vaccine, but I'm not going to get one because I heard vaccines are bad. We care about those things. How do we instigate a conversation about them? How do we get others to buy in and care about those topics too? So to me, when I think about pitching, I always think about caring. Here's the thing I care about. How do I make you care about it? And I do think that instead of jumping into a story or even a conversation straight away, it's really useful to use these kinds of criteria, especially ones that are framed as questions, because it makes you sit down and start to attempt to answer some of those same questions that your readers, your editors, your bosses, your colleagues are going to have.
So I wonder if, Seema, if we can, there are 2 things that I'd like to do with folks. One is to give them a chance to do a bit of work on this, particularly on the first 3 questions. But I always love to see first if there are questions about this or reactions to this.
And Rob, someone, Patricia has said in the chat that pitching looks like grant aims. And it is, it's all the same kind of storytelling. And that's why, we're able to teach this across disciplines and to different people, whether you are a scientist or a healthcare provider who wants to write a book about your pandemic experience, whether you want to write a blog post or an op-ed for the New York Times, or whether you're just thinking about how to broach these conversations in the clinic, or you're thinking about how to raise funds to continue your work.
Yeah. The one thing that, so I saw that question too, and I really like that. That's exactly right. And in fact, more and more grants, as I'm sure folks know, the National Science Foundation includes this in its grants. I don't know if the NIH does. In Canada, these are being included. I think same in the UK. More and more grants actually require you also to talk about the public impact that your research might have, right? And so this is a way to think of that. There are differences, and one of the differences is speed. We journalists get very frustrated by the pace at which a grant application comes together, collaboration over the course of months, blah, 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 right? This stuff happens you see something that happens in a couple of days, bang, right? Or, maybe a week, and it depends on the size and the scope of the story. But yeah, very much. Yeah. So NIH does. Thank you. Yeah, I figured that. I figured that.
But also, Rob, I will say that, like, having worked at a large daily newspaper, there were reporters like me who had to churn out stories every day, sometimes 2 a day.
Yeah.
The Dallas Morning News, like many newsrooms, was very invested in investigative reporting, actually, especially in health investigations. And so those investigative reporters were often left alone for 6 months, a year. Do a deep dive. So I just want to make sure people realize that distinction too. For sure, there's journalism where every morning you want to know what the breaking news is, you want a quick analysis, but then there's also that slow stewing long form journalism that does, takes its time.
Yeah, absolutely. Were there other questions folks wanted to, should we just sort of go through some of these on here, and then we can get into the exercise? I see from Kula, what is the best step for a physician scientist to communicate honesty, breaking misinformation to his or her patient, which is hurting the well-being of their patient? Seema, you've treated patients, I've not.
You want me to just answer? Yes, this is the crux of all my scholarly work, to be honest, the first best step, or all of the steps, to be honest, Kula. And that's the point of the 2 parts of this webinar, is that there's not a one easy fix, but there's a number of steps we can take to trying to build bridges. I think, I know people who just won't talk about vaccines with their doctors because their feeling is, and they're not that wrong, that they're going to go in and the doctor's going to be like, well, that's silly. Of course, vaccines are safe. That's not maybe the best step to a conversation, right? The beginning of a conversation. The best step then might be that, well, you're a parent, you really care about your kid. You care about your kid so much that you're concerned about what vaccines we give them. How do we start a dialogue where we can build trust, where we can take our time and think about those issues at stake? So I don't have a quick fix for you, but all of this, even what we're talking about in terms of pitching, writing, reporting, all of that plays into how we counter dangerous, false narratives that negatively impact our patients and our community's health.
And one other thing I'll add to that a little bit is, I think it's important, going back to this model of patient-centered care, right? Where understanding that the physician is a person, right? That the physician is not an encyclopedia, the physician is not God, the physician is a person. I think it's actually important to be able to say, I don't know. And I was watching, we had up here in Ontario a couple of excellent technical briefings that were chaired actually by our dean of our School of Public Health, but they were in his capacity as an advisor to the province. And there were a number of questions when he was able to say, if I recall properly back in April, we don't know. But we don't know, and then, there are sort of a few options. We don't know, and it would seem like we should know, but we don't really need to know that datum because it's not going to really affect the way we do it. Or we don't know and we're unlikely to know, but we have a surrogate datum that we can actually use for this. Or we don't know and it's a problem and we're trying to figure out how to get to know, which is why we're improving our testing protocols. So the capacity to honestly say, I don't know, allows you to engage with a patient or anyone in a sort of a humble way where they actually build their trust for you. And they might actually even then be invited to share some of their knowledge with you. I'm speaking as a non-physician, non-clinician. I don't know how that really plays out in the clinic, but I do know how it plays out as a patient. And it helps me as a patient.
And I teach the same thing when I teach these kinds of webinars to journalists, that there is uncertainty in an epidemic. I started off my public health career investigating epidemics. Things change every day. Sometimes they change from morning to afternoon. Uncertainty is part of the story. And actually, you build trust by saying, I don't know. And we know that through clinical practice too. Nobody wants a know-it-all doctor who pretends to know everything. You have to be really upfront and honest about, that's a great question. I don't have the answer. I'm going to go find out for you. So one of the things that I teach journalists in that context is that there's a temptation in journalism to tie stories up really nicely. But actually, sometimes these stories are open-ended, especially at the height of a pandemic, when the guidance is one day you don't need to wear a mask, the next day you must wear a mask. And so we have to be careful that we're not trying to tidily wrap up stories in a way that isn't truthful and reflective of the environment. Uncertainty is part of the story. It can build trust if whether you're an official saying, we don't know, here's what we're doing to try and find out. In the meantime, here's what we're doing. That part of saying, I don't know, there is uncertainty, communicating that uncertainty done in the right way builds trust, whether you are that public official, whether you are a clinician, and whether you're a journalist.
So, and then the last thing I'll say, just to wrap this up or on this topic and bring back to these criteria, is to Seema's point, that's why it's really important when you're pitching something to pitch a specific topic, right? I'm focusing on this one story is only about this because I can speak to this with a little bit more certainty. And then also give yourself the comfort of knowing, as journalists do, that, you know, no single story, in fact, no single book, no single university program is going to be exhaustive on the topic. You're just peeling the pieces away, piece by piece by piece, one story after another, which is why it's also going to be important, we'll get to this a little later, to think of more than just one story. Everyone here has a story in their mind already, I'm guessing, but you may not have two or three. And if you want to have impact and you want to actually be able to approach the stories humbly, it's no more than this, it's just this little piece, then you also have to know how to get back in and find the next piece and the next piece and the next piece. You do, you know, have a multi-part podcast, or you're not pitching just one thing.
Absolutely. And I will say, you know, again, on that issue of uncertainty and trust, even myself now, as somebody who works on CNN, as somebody who conveys information about the pandemic, I feel a responsibility to know everything, even though I'm human and I possibly can't. And we've only known about this infection for 6 months. And I can't fake it. I just have to say the things that we know and the things that we don't know. But the impact that that has sometimes, it scares me, because I think, oh, people are going to think she doesn't know what she's talking about. Oh, she's not a good source of information. And completely the opposite thing happens. I want to share this with you just in case you worry about that too. So a couple of weeks ago, I wrote an op-ed for the New York Times, and it was about my experience working as an officer in the Epidemic Intelligence Service at the CDC. So colloquially known as disease detectives, we were the group that was tasked to go out anywhere, any hot zone in the world, deal with an epidemic. And my op-ed was about how messy this is, about how political, small p, political pandemics and epidemics are. There were so many political and bureaucratic obstacles in my way as a disease detective. And my op-ed was saying, this is how it used to be, and it's even worse now. And it's like big P politics involved. You would think, and I was thinking, oh gosh, that's like really washing public health, dirty laundry, like for everyone to see. And for the public, that this might just make people really scared. The responses I got were overwhelmingly, this gave me comfort. And I was like, comfort? You got comfort from this story? But people said they found it really helpful to know what happens behind the scenes. So even that action of pulling back the curtain and showing things are messy, but we try our hardest, things are challenging, here's how we work around them, actually gave people some level of trust and maybe a little more certainty than just completely not knowing how the sausage is made.
Totally. Should we get into an exercise, Seema?
Yes, please. And I'm just looking to see, because I did say to all the attendees, if you have a particular pitch that you're working on or you have in your mind an idea for a pitch, even if it's very early on, put it out there and we can directly work on that.
Totally. And in fact, the exercise is designed around exactly that. So what I'd suggest is that you take, I've been advised in the classroom, these things should be no more than 5 minutes, but I think on Zoom, it's probably more like 3. Maybe take 3 minutes or so and look at those first 3 questions. And whatever idea you have in your mind that, you know, motivated you maybe to actually join us on this course, try to format it around those 3 questions, 1 sentence each. Remember, when you're pitching a place, you'll only pitch 100 to 150 words. So try 1 sentence for those first 3 questions. And for the last one, tension's a weird word. So ask rather, what's changing? What's being challenged here? And then we'll take, I think we'll have time to maybe take 1 or 2 in the chat box if you want to throw them in there, and we can respond. So I think just another minute or so. So that puts us at about 3 minutes. Should we jump in? I noted, by the way, that we were a few minutes to transition, and I don't know if that was transition to the next topic. I assume it was, but I wonder if we have some time, Seema, if we can just take a couple of ideas from people. I don't know if the model for this, that people bang them into the chat, maybe cut and paste them into the chat or bang something in, or
anywhere you like. I'm looking at the chat, I'm looking at the Q&A, so anywhere that you would like to share with us your thoughts on a topic and addressing those first 3 questions, we'll be happy to look at them.
So I see one from Daniel Cap. Discrepancy, it reads, discrepancy on COVID-19 testing is planned in the US. Dr. Fauci says more testing. President Trump says less testing. Who is the public to believe? Yeah, I mean, that would be, you know, on the surface of it, I would say that, you know, the way that it's phrased there, you know, just given Donald Trump's, and I'll just say this as a non-American, less than stellar record in public health science over the last little while, I would say that intuitively, Dr. Fauci, if I'm looking at this as a pitch, as an editor, I would say Dr. Fauci is a more believable guy on testing than Donald Trump, elected office notwithstanding. But one way to turn that pitch into something that might be more, I don't know if all the panelists and attendees saw this, but if everyone saw that particular pitch, but I would be curious as a journalist, right, to see if there are other, yeah, sorry, I think, so if you're putting something in, maybe make sure on the tab that it goes to all panelists and attendees, so it's not just coming to us. I don't know if it's possible. Otherwise, we'll read them. So Daniel Cap's pitch, discrepancy on COVID-19 testing is planned in the US. Dr. Fauci says we need more. President Trump says we need less. Who is the public to believe? Okay, the attendees can't message louder. The interesting pitch there might be to actually grab something quite counterintuitive on number 2, would be to ask, you know, are there other serious, legitimate public health or infectious disease experts other than Dr. Fauci who have a different view than him? And it may be that there aren't, and I don't want to suggest a false equivalency here, right? If the standard, if the basic science is saying we just need more testing, period, then that's it. But actually a more nuanced thing might be, what does more testing actually mean? Does that mean 320 million Americans get tested at the risk of having false positives sort of overwhelm the system? Or does it mean more testing means targeted testing? What actually are the debates going on? Because there must be real debates going on among people who all agree on new testing. There must be debates about what does more testing actually mean in what population. I know that's the case in Ontario, where we all believe that we need more testing. There's no question about that. But our premier, who's a little bit like Donald Trump up here, said, everyone go get tested. And the chief medical officer of health said, no, not everyone get tested. It's people in specific groups. Otherwise, we won't know what to make of the data. That kind of story, that lends itself to something counterintuitive, which is, oh, I thought it was all simple. I thought it was just more testing. Not quite. There's a deeper conversation going on here. There's tension. There's legitimate tension between different models of how testing should actually be executed and set up. And clearly it's important. And you want to explain why and remind people, why is this important right now where we are in the pandemic? So I think that could actually be a really interesting story.
And one of the things that you'll think about is that many of us are asking this question. So you might have this initial fear that I'm sure someone's reported this story. Surely someone's written about testing, of course, but then this particular tension between Fauci's advice and what Trump is saying, but never be deterred by that, because yes, somebody may have written it, but it's your job to go find as many of those stories as possible, read them with a pen, meaning that as you read the story, you're like, oh, that raises a question for me, and the story doesn't answer this question, or oh, they're really looking at this particular angle, what I want to do. So you hope actually people have written about it, and you want to find the gaps that have not been addressed. You want to find the questions that haven't been answered. And sometimes it's really helpful to go look at what has been written so that you can find your niche and you can add value by offering something new.
Yeah, 100%. You have to remember that every journalist is also gone through the exercise of cutting out most of the stuff because they're also trying to focus on one thing, which means that they're leaving a whole lot of stuff out for you to then pick up on. Reading for gaps is a core way of moving the story forward. I see another one here, looking for strategies to address our anti-vaxxers in an environment where I'm already viewed with distrust because I'm a member of the establishment. They're already preparing their arguments against a new COVID vaccine. Absolutely, I have to work on this in increments. I want to venture something here, but Seema, you're the real expert on this one. But I want to venture something that's come out of some insights from colleagues that I've been teaching here at U of T, who are very much in the vaccine preventable disease world. And one thing that they've noted, we have a new Center for Vaccine Preventable Disease at Delana that's just been set up as led by, I forget my colleague's name, I'm quite embarrassed. But one of her insights is that sort of demonizing, I hope I'm representing this correctly, demonizing anti-vaxxers as irresponsible, stupid, negligent, murderous, whatever it may be, is sort of counterproductive. That in fact, according to her, a lecture that I heard her give, a lot of anti-vaxxers are incredibly health conscious. They have read a lot on other dimensions of their life. They're eating well, they're doing, they pay attention to their health. I think one of the questions here, and it's a journalistic way of seeing things, is to start with the curiosity. What led you to this? Why are you thinking this way? I want to understand there's some positive value here at the heart of this that I actually want to tap into. It's what allows a Vice reporter, very obviously from the hard left in Brooklyn, I'm guessing, to have gone to Charlottesville and to have sat with, and there's a great video about this, to have sat with a white supremacist for a whole day and really understand and bear witness to his racism because she didn't come out attacking. So I would suggest that's a beginning of a conversation, and that's sort of what journalists actually do. So Seema, but Seema's been in that room, I've not.
I'll talk about the anti-vaccine movement because it's something that I spend a lot of time thinking about and studying. I will say for the white supremacy thing though, it's difficult to engage when there are people who just question your basic humanity and right to live, right? So for me, that would not be safe. That is not a question, that is not a conversation I'm willing to have if somebody doesn't see me as fully human, for example. Leaving that to one side and thinking about the anti-vaccine movement, Rob's colleague who says that just labeling those folks as like dumb and they don't care, not only is she right that it's counterproductive, but it's also inaccurate to label them that way because they're not dumb and they're not trying to do things that are dangerous. They are often very well educated, wealthy people who care a lot about their kids and who care a lot about their communities potentially. And so you have to find that nugget of connection that, oh, as a clinician, I really care about your kids' health, and as their parent, you really care. So if we start from there, then how do we build out? So yeah, that's how I look at it. And a lot of what Dr. Barrack and I do in terms of teaching, whether it's medical students or whether it's veteran faculty, it's all about compassion and empathy. It's just hard to move into and through a conversation if you're starting off with, we both hate each other and we are both completely disconnected from each other.
Great. Are there any other pitches that people want to share? Wait a couple of seconds to see if anything pops up. There's one in the Q&A. Sorry. I will go down to the bottom of the Q&A. Hold on a second. Stigmatized. So first of all, I apologize. I'm trying to sort of watch all the screens at the same time. stigmatization of patients in India has been a huge issue since it means many patients are not coming forward to get tested, and hence the true numbers are not known, and also contact tracing not possible. Great story. I mean, right off the top, right? So I put that up against these three criteria. First, why is this important? You have to think about who you're pitching this to, right? So if you're pitching this inside India, it's one thing. If you're pitching this outside of India, where we're increasingly aware of the nature of the pandemic in India and how sort of early signs of relative manageability have really given way now to something that is very dangerous and growing fast, it seems. So you're going to pitch it differently to different audiences. Counterintuitive, you'd have, I don't have enough context for the India story to know, but I'd be curious about the stigmatization, what kind of stigmatization we're talking about. Is it poverty? Is it caste related? Is it regional? Is it just fear of showing that you have disease? You know, and clearly there's tension, but what I would want to show on number 3 is, with regard to what is changing, is what are people actually trying to do about this? If I'm an editor, my first question is, okay, this is a problem. Show me how significant the problem is. Give me a sense of the size and of the stakes here, why this is a problem, but also give me a sense of what people in India, public health people in India, are trying to do to address it.
And
that's creative ways to do it. Yeah.
And that is a solutions journalism approach, which is really useful and just nice to read sometimes, where you're not just reading about a problem, but you're reading about how people on the ground, grassroots organizations, other groups are actually tackling sometimes what feel like intractable, you know, unsolvable problems.
So, and I see one last one. Maybe we could do one last one, and then we'll jump on to the next set of skills, if that's okay.
Sounds good.
So I'm looking at one from Texas, and it reads as follows. Even as COVID-19 cases skyrocket, universities reopening for classes this fall speaks to another problem. Public health will always be sidelined to business, and higher education is a business first. So I'll react to this the way I would if I were an editor. That might be true. I work at a university, it's a public university. Seema works at a private university, so it might have a different perspective. But I would be skeptical about, I think it is too simple to say that. And if I'm an editor, I'm like, it looks like you're coming with an axe to grind here. I'm not saying this about you personally, but this idea looks like it has an axe to grind. I'm not sure I believe this. Maybe yes, but my guess is that it's more nuanced than that. But it raises a question, which is, why are universities, including a lot of universities with great medical schools and great public health schools, why are they opening? What's gone on behind the scenes? What were the arguments at the decanal table between the deans and the president, and the student services table and the student government? Like, where was the pressure for this?
And I'd love to, sorry, Rob, to interrupt, but I'm just thinking, oh, that's a great story idea. I want to read a story about 2 deans at 2 universities taking different approaches to this. And I want to understand how they're justifying it, how they're processing the information. How are they looking at potentially similar numbers, but coming up with 2 different strategies?
Yep. And another way, so that's one way to do it. Like what, and there've been some really interesting stories which take otherwise comparable universities, in terms of student access. I know that this has been a financial access, taken 2 comparable universities and looked at their different strategies they've taken. One question I would have, I would look for the counterintuitive. I wonder if the deans of medicine or the chairs of medicine or the deans of public health or deans of education at those schools have made an important public health case to open. I don't know, like, and I'm not, and if it sounds to you like I'm some radical, like reopen now, liberate Michigan kind of person, I'm not, but I'm a journalist and I'm curious. And my question is, if you have a university that is filled with smart people who care about their students, it's not just about making money. How do they get to this decision? And it may be that if you go with an open mind, you actually find that there's something surprising. Maybe there are some folks in public health who say, look, if we take a whole perspective on public health here, there are a lot of students who will be at serious risk if they're not on campus. They may not eat. They may be in marginal situations. They may not have a good place to live. We bring them onto campus, at least we can monitor them and control the environment. Who knows? But you might come up with something really interesting if you approach the question with an open mind and then pitch that. But that would require calling and reporting, which is what we'll get into in a second.
So Rob, if somebody is looking at these 6 criteria and thinking, these look really helpful, but I just don't know what I have as a story idea, I
Yeah.
don't know where to find one, then how do you start that process?
Right. Okay. So let me, maybe we actually then let's go into, because I was going to jump all over the place, but let's stick with the original plan because you
Yep.
segued so nicely, which is actually a great journalistic skill, and not go to the writing structures one. Let's go to,
We just passed that slide that we want to go to. Where do you find story?
yeah, where do you find stories that are obvious? Perfect. Thank you. Okay. So we're now sort of in a different, a slightly different domain. Which is finding stories, finding more than one story. I think everyone will have one or two things that are on their mind that have been bugging that they want to get. When we teach this, I ask folks to come. It's an 8-month intensive program, and I ask folks to come with a couple of ideas. And it's amazing how quickly they can pull off, with our guidance, a really good pitch and a really good story. By October, they're getting published. They start in September. By October, they're getting published. And then we get to November and they're like hitting a wall because they only had one idea. And then the hard work actually begins. That if you just want to write one idea, you don't need much more than what we've already given you. If you want to be part of the conversation, enough of the conversation or core enough to the conversation that you're shaping the way that people are thinking, you need to be in more often, right? You need to, if you're looking at a podcast, right, you'll need an episode every couple of weeks, every month, every week, whatever it may be. So you need to find more ideas. You need a steady stream of ideas. So here are sort of 5 tips that I have, and then I'll throw to Seema. One is to actually speak to people, right? So actually this is all premise. If you remember going back to that first slide, that wrapper around the outside. Wrap around the outside is like, pick the place, pick your hunting ground, pick the place you want to hunt. You're not, if you're in health or medicine or an allied health profession, you're not going to be covering all of health. It's way too big. Pick a piece that you love, or 1 or 2 pieces that you love, that you don't mind reading about every day, listening to every day. Within that, one is to actually speak to people, right? So you see someone who's written an interesting paper, you hear someone who's running an interesting podcast, you see an interesting source in a news article who is giving you insights. Start to speak to them. Pick up the phone. Being a journalist is a great excuse to do stuff that we're not allowed to do in other lines of work, like actually call people with open-ended questions and say, I'm a physician, but I'm also a freelance journalist. I'm just beginning, so you're not going to see a lot of my clips, but I'm just beginning and I'm curious about this and I'd like to learn a little more just to see if there's a story there, right? The more folks you actually speak to, the more you will learn. And very importantly, speaking to people is different than reading what they've done online. If you're just reading their stuff, then it is by definition old. It may not be old in the academic chronology. It may be 6 months old, 3 months old, may look like a really fresh paper, but things have changed since then. And when you actually speak to them on the telephone machine or perhaps on Zoom, you will find out what their latest thinking is and what the latest is. So the more of a network that you have, and journalism is a great excuse to build a network that's going to serve you in all sorts of other ways. The second is doing what I'm sure you guys all do already, which is what I call reading upstream, reading stuff that mainstream reporters are not reading. So that's the journals, clearly. And by the way, you can assume that any health reporter already knows what's in the New England Journal, JAMA, the BMJ, and the Lancet, right? So that doesn't give you any kind of edge. But the Journal of Reproductive Technology, I'm making it up, that may give you an edge. The Journal of Race and Infectious Disease may give you, I'm making that up, may give you an edge, right? Sorry, Seema, you're jumping in?
I was just going to say, make up some more because these are going in an interesting direction.
So reading stuff that other folks aren't reading, and to an earlier point that came up around social media, following folks who you find are trustworthy, who other folks may not be following on your Instagram, on Twitter, on Facebook, on whatever your social media actually are, to sort of see where their conversation is and follow the people they follow. So that's reading the stuff that conventional reporters and editors are not reading, and that puts you in the stream. Seema, I'll just keep going through these 5 and then throw to you. Is that okay? The third is exactly what Seema was describing before. Reading, where's my pen? reading with a pen. So this is reading the mainstream. Now, we're reading online, so it's hard to sort of circle online unless you want to print it out. But yeah, read the Times, read the Post, read the Atlantic, read the Guardian, read your local newspaper, read the mainstream stuff that is covering this stuff well, and look for gaps, right? So look for questions that you can spot because you know the field that a layperson like me would not be able to spot. Oh, this person has this on the science. That person seems like they're agreeing, but actually, it's sort of it would lead in a different direction. I'm curious about that dissonance, or that looks like a very interesting new insight that I don't take for granted. I'm curious about that. Look for things that have not been covered thoroughly in there. That will also give you stories. Last couple of things. This fourth one, I normally show a slide, which we don't have in here, but I can represent it with my hands. Most journalists hit a story, if you can look at sort of the apex, right, the sort of downward pointing apex of my hands on one point. The story is actually really broad, but most people are on this, right? So COVID-19, as an example, is massively complex. There are so many dimensions to this, right? But right now, everyone is looking at testing or not testing, open or close, shutting or opening. How do we reopen? It's like we're all the mainstream guys are on one story. If you can think of this or this or this, right? If you have a different lens, if you're a pediatrician and you're seeing different, or if you are a physician who works in the area, if you're, I don't know, a rheumatologist, right? You're working in a different kind of infectious disease, or if you were working on something totally mental health professional or something completely different, and you see COVID through that lens, you're going to be covering this over here in a way that complements this stuff. And editors are really bored of all the things that are in that point. The final thing I would say is connect the dots that others don't. Most of us are working in our silos, right? The virologists speak to virologists. The infectious disease folks speak to infectious disease folks. The family docs speak to family docs. If there is a gap between what the virologists are saying and the family docs are saying, connect those dots, right? Sort of say, the advice is coming out of here, but there's other advices coming out of here. There's something here. There's a tension here. That's important. That's worth exploring. So those are at least 5 ways where you can continually and keep looking for stories and write them down in a journal. So you're keeping track of them. You can't get to all of them, but keep track of them, mull on them, gather information on them. Over to Seema.
My editor would have me keep a Google Doc of ideas, because even as you're reporting one story, suddenly a source says something to you and you're like, wait, I need to come back to that. So the stories are everywhere. I think using those tools that Rob has shared, you won't ever be short of a story. In fact, you'll have so many story ideas that you'll want to give them to other reporters because you will want them to be covered and you will want to read those stories. And so as Rob said, like having a beat is very much like having a specialty. It's your niche, it's your area. So it's actually not too tough to kind of get deep into the weeds and build up a habit of like listening to all the podcasts on that topic, reading the journals, making sure you're looking at all the reporting that's done on that area. And then being a journalist gives you license to pick up the phone and call people. And maybe everyone has that license, but I certainly didn't realize it until I was in Rob's journalism program years ago. So one of the things he said to us early on, I can't remember exactly how he framed it, something along the lines of, okay, so you're looking at a scientific paper, like what are the first few things that you do? I said, well, I look at the conflict of interest because I'm an epidemiologist. I want to make sure like who's written this, what are the disclaimers? And then I said, I look at the methodology section because I want to know how robust the process was. And he said, you look at the contact information of the first author and then you call them. And I thought, oh yeah, I guess that's a thing you can do if you really like have questions. And it's amazing how much time people will make for you. You have a question about the receptor binding domain of the spike protein of SARS-CoV-2, and you call up the person who in the Netherlands, who is an expert on like the 3 amino acid region. They will want to chat. They will want to tell you things. They will want to tell you how hard it's been to get funding and now how they're working. Like people will make time for you. So call them up, be a bit annoying. I just found a note in an old journalism notebook from a conference I was at where it talked about just being like persistent. Keep calling the people that have the information is what I had written down in quotation marks. I don't know which wise journalist gave that advice, but it's true. The information is there. The stories are there. It's your job to go and find them. On that note, are there questions? Are there thoughts that you have about how to find ideas that aren't obvious, how to move the conversation to where it should be, in your opinion?
So I'm watching the Q&A, and I suppose, it's also in the chat?
I'm looking everywhere.
I trust you guys and Jonathan to
I like this point about the computer scientist. So Katrine, I'm doing a PhD about science communication, and I want to create a browser game aimed at teaching scientists about the kind of anti-science discourse they can expect to face. Katrine, I would say look up the Bad News Game if you haven't already. It's an intervention developed between the University of Cambridge and scientists in the Netherlands. And it's not health specific, but it uses a gaming system, and it turns gamers into bad actors who spread disinformation as a way of immersing you in the world of disinformation and how easy it is to formulate those messages and how to spread them. But by doing that, it also shows you how you can become a better consumer of information. So I would definitely check that out. And I'd love to see what you end up working on.
I want to add something to this. It's a little bit off the topic of this specific slide, but I want to make sure that people feel that. So what one of our other colleagues, in fact, Seema, you're maybe going to be meeting when he comes out to do an ICU fellowship at Stanford. Blair Bigham, who is in our program a couple of years after Seema. He's an emerge doc and an intensivist, and he's also a very active journalist. And he does journalism training for physicians too. And he's very careful, and I know Seema shares this view, to make sure that journalists understand, that physicians understand that media training, conventional media training, is often considered, is actually really anti-media training, right? There's a suspicion of journalists. And while the misinformation piece is really, really critical to understand, and at the same time, without discounting that at all, you should feel comfortable trusting serious journalists as serious places. The amount of work that we do to make sure we get stuff right is just huge. My dad, as I think I mentioned, is he's an endocrinologist. He did a lot of these sort of pioneering studies on metabolic syndrome, diabetes, and atherosclerosis. He was quite a giant in his field when he was working in there. And my folks at one point came out to visit me in Asia, and I was working on a page one story for the Wall Street Journal while we were on holiday. And I ended up on a 2.5 hour phone call from the Philippines with my editors in New York. And my mom, who was used to seeing my dad write grant applications and review journal articles and be reviewed and answer reviews, sort of came in after 2 hours like, oh my God, you're doing as much work on this one story as your dad does on a paper, which I don't think was true, but nonetheless, it illustrates the amount of time that journalists actually spend trying to get it right. So even as you are fighting misinformation, recognize that good journalists are your allies, and that is all I would say.
Yeah, and it's important to build those relationships. And I can definitely say, having worked at some public health institutions, that the training is very much to try and stay away from journalists. And we need to be doing the opposite. We need to be building those bridges and building relationships. And there's ways to vet journalists. I'm happy to share some of that information too. But do your due diligence. And then, as Rob said, be aware of some of the fact-checking process and the diligence that goes into the reporting on the journalism end.
I wonder if, should we move to an exercise? I don't see any questions popping up about this, unless I'm missing them.
Let's move to an exercise.
Okay. So of these 5, I'm actually going to, sorry, can we go back to that slide? Thank you. Of these 5, and I say big thank you to Jazona for moving the slides and organizing the whole thing with Destine and Megan. Of these 5, I want to pick up on what Seema was talking about, how the most important, if you will, the thing that is a real game changer, and frankly, the most fun part of this whole thing, is actually picking up the phone and calling the person who you never thought you could actually call. Most journal articles of note have more than one author, so you can call any one of them. And most are cited by other journal articles that have more than one author. So there's like a whole world of people you can call to gain insight into, what's behind the science that you want to report on. I'm going to invite you to take again 3 minutes to write down a bit of a wish list, maybe of 3 or 4 folks whom you would want to call. And to start to reach out to, and imagine that the question you're asking them is something along the lines of, hi, Dr. Professor or Ms. So-and-so, I've been following your stuff for a while. I've always found it impressive. I'm just wondering, what's the latest? What are you hearing now? Since your last paper, what have you heard? Where are we now on this science? So if you think of that, write down 3 folks who would be on your wish list, and then like quietly maybe even commit to calling one of them next week or something like that, or later this week. So I'll give you 3 minutes for that. And if folks feel comfortable sharing any of those, that would be great. And anyone can be on that, by the way, you know. So I think just another minute or so. Okay, great. Does anyone, I saw that there was um, one interesting idea. One interesting idea from Lawrence Hammer, who shared it with the panelists. Seema was responding there. Hold on just a minute. That he would call one of several pediatric infectious disease experts regarding vaccine development. He mentions Stanley Plotkin, Paul Offit. Seema, you asked, I shouldn't say what you asked, you should, enough mansplaining.
Oh, that's fine. I was just asking Lawrence, like, what is it that you might ask them? We were just going back and forth in the chat. And I think that it's also important to question who comes to mind first, right? So for example, say you want to write a story or you're doing the early research and you think, oh, COVID-19 vaccine, who would be the right person to speak to that? And then you just start scribbling and then you get to the end and then you go have a cup of tea and you come back and you're like, these are all old white men. Like the woman leading the NIH studies is a Black woman. Like, is she on my list?
Mhm.
Are there people who have a different lens? Are there people that live in the global South who are working on a vaccine? What could I learn from them, and what storytelling can I offer my readers? So always be thinking about the diversity of your sources. And I know sometimes, especially when I've been doing these webinar trainings for journalists, I get the sense that people are like, we're in a crisis. Who cares about diversity? But we really care about diversity, because it's not about a political correctness. It's about getting the story, and you don't get the story unless your sources are disabled people, are people in the global South, are people who work for different kinds of governments, are men, are women, are transgender people. You're just missing out on huge swathes of humanity if you're not including those. So just keep that in mind. And we all have our own individual implicit biases and our own little gaps, so just be aware of what yours are.
Right. So when you're writing about when you're interested in an anti-vax thing, speak to the anti-vaxxers. To your point, actually, Seema, you were talking earlier about populations. We have the same, who were resisting being tested for TB.
Yeah.
We have exactly the same situation in the Arctic with Inuit populations. Americans would call them Eskimos, who refuse to be tested not that they refuse to be tested for TB, but that TB is not, that there's very little contact tracing in TB outbreaks in the Eastern Arctic and Canada, not because the Inuit have refused it, but because the public health authorities up there don't know how to go about doing it, given the same legacy, right? The issues there, if you're talking about a population, put that population front and center. It's so easy to call the professor at the university who wrote the book on that subject, or the history, and to speak to her or to him, but they will not know the story as well as the people in the middle of it. And if the people in the middle of it don't recognize themselves in the story, then the story's missing sort of his most key piece. One of the things I love about Lawrence's idea of calling pediatric vaccinologists about this is that the whole anti-vax movement comes out of the pediatric world, but we think of the vaccine to the COVID vaccine. The COVID vaccine doesn't exist, but we think of the theoretical, imaginary, magic COVID vaccine strictly in adult terms. The real question, so bringing these two worlds together is counterintuitive. Speak to the peds who know this stuff and their experience with it, because even though it's the adults who are probably going to need it and get it first, the peds understand what the issues are around adoption and vaccine hesitancy. So I think that's really cool.
Yeah.
Particularly in an environment where the other piece is that we keep talking about how fast the science is, and phase 3 in and out, done in a week, which will raise all sorts of concerns. Other ideas of who's on your wish list? I'm also watching
So Espen is asking us a question.
Okay.
When reporting on science findings, do you find it challenging to communicate with the expert or researcher? Do you sometimes worry that when finding the right way to write the article, to phrase it in an engaging way, that you might lose sight of the findings? So the reporter's role versus the scientist's role. So this is the line that I straddle all the time. One of the things I have to be careful about is when I'm interviewing an oncologist for a story about a new cancer treatment, that I keep reminding them, yes, I'm a physician. I'm not going to pretend I'm not, but I'm not an oncologist. So please explain this to me in 3 different ways that I can try and use to explain these technical things to lay audiences. I don't worry that I'll lose sight of the findings, because I'm so focused on communicating that and thinking about innovative and compelling and engaging and memorable ways to communicate that with my audience. And I often find that the nice thing about picking up the phone to talk to an expert or researcher is they're like, oh, someone's interested in this thing that I've worked on for 12 years of my career, sometimes 40 years of my career. So I haven't found that particularly challenging. I do think that the part about phrasing it in an engaging way, yes, that's tricky, because I'm not trying to lose any of the nuance, any of the complexity or uncertainty, but I'm thinking very much about my audience. Do I have 3 minutes on CNN to say this? Or do I have 3,000 words in Wired? Who's watching CNN? The audience skews older. Who's reading Wired, for example? Is this a study that I'm tweeting out? So I'm always thinking about audience. And that's like a challenge, but kind of a delicious challenge, because you're thinking, oh, I've got these nuggets of information. How do I communicate it to you in particular?
The other thing I would say is that journalists also, and if you're thinking as a journalist, to not be captured strictly by the perspective. This is going to sound weird, and it's going to, and I worry that I'm sounding anti-science in what I'm saying, and I'm not. I think Seema would agree I'm not
I'll
anti-science.
jump on you if you do sound anti-science.
Okay, please do. But to not be captured by what one scientist or one paper is saying about their data. I'll give you an example. We had one of my colleagues, a very good, really impressive investigative reporter up here who does a lot of public health investigative work, was looking at some health systems data. And I think it was about, I forget, I mean, it might have been about C-section volumes or something in Ontario hospitals. And the health systems researcher who was looking at it was looking for, a statistically significant result on, I forget exactly what question she or he was asking. But what Rob, my colleague, was looking for as a journalist was the outlier. And they got into a real sort of clash of perspectives and values here. The scientist was saying, I don't care about the outlier. The outlier doesn't tell us anything. It's actually what is a statistically significant result. And Rob was saying, yeah, I get the statistically significant result is really important, but if everyone is doing this right, that's not the story I'm interested in. That's fine. That's good. I'm glad. What I'm interested in is the 3 hospitals that are not doing this right. And I want to get into this. So there are all sorts of perspectives to take on a set of data. And there are perspectives to take on a study. And so that's why a good journalist is going to look at a paper, look at a study, speak to that person or the authors of it, and then also cast their view beyond that person to other scientists, credible scientists who are doing good science, who are also looking at the same issue, who might say, yeah, very dramatic, but methodology was a little weird. Or yeah, but that actually doesn't tell us anything new. We had a similar paper out 3 years ago, but the state of science is now here, right? So that's actually where editors are now driving more and more science reporters, is like, if you're going to take dictation off of one paper, I'm not interested.
Oh God, I hope that's been happening for a long time, because that's really worrying to me if you're writing a story off a press release or off one person.
But that's
the beauty of being a curious person, right? You talk to somebody and you're like wowed by their science, but then you want to talk to their peers to be like, what do you think of this work? What do you think of their study design? What do you think of this person's ethics and how they've conducted science over the last 10 years or so? And that's how you find more and more stories, is by talking to more and more people and kind of broadening that network too.
That's great. I think maybe we should jump onto the next topic. I see that Sunil has thrown us a different example, and I'll just take very quick note of it. Okay, sorry, I was just looking at a quick note there. But let's jump onto another one. Sunil's just a very quick example was calling up a bunch of specialists who are looking at different weird symptoms that are coming off of COVID. That would be great, actually exploring, going down that slightly different tangent. Let's jump now onto the last couple of quick topics here. And I just want to give, sorry, if we can go to a slide, the slide that says a reporting strategy, because it really builds from what we're talking about here. There you go. So we're not going to spend too much time on this, but it's just to give you an idea of once you get into what you do, once you get into calling people who are not you and not the other folks in your lab or in your clinic to understand an issue that you may feel you know a lot about, but where you really need to discover more. One of the hurdles that journalists typically face, particularly sort of people starting out, is they have 1 or 2 names, right? I have 1 or 2 names of folks and they're totally inaccessible, or they don't want to speak. Or if I'm doing something about accountability where I'm calling into question, let's go back to that idea from the colleague in Texas, calling into question the motivation of universities, right? I'm going to call them and they're going to get all defensive. How do you actually start to get into the folks who have who can help you? And there's a sequence to these calls when you're actually reporting on a story. On any story, on any issue, there are some folks who want to talk. They are the kinds of folks Seema was talking about, who've been studying this one thing for years and years and years, keep dreaming that their kid is going to ask them a question about it at the dinner table. That's never happened. And now suddenly you call and you ask them, not even their grad students are interested. You call, you ask them, they want to talk. There are advocacy groups, right, who also will want to talk. They've been accumulating stuff. No one's been paying attention to them. There are all sorts of folks who actually want to talk. So that's actually one of the places where you start. If that's all you do, though, then you end up with a very limited perspective on the story. So having built up some understanding of the story based on the folks who want to talk, you then need to go to that next level and approach the folks who don't necessarily want to talk or who may be inaccessible and say, look, I know that you may not really want to talk about this, but here's my understanding of the story so far. If this is wrong, I need to know, and I need to know in the next week because I'm actually going to be writing a story. Please, I'm giving you a chance, right? And then you're persistent and you're going after them. Not after them in a malicious way, but that you are persistent in trying to engage them. The other dimension of this is to report both at the individual level and at the system level, right? To think of individually where these stories are coming from, the individuals who are experiencing something, but every time you hear a poignant, important story from an individual or an individual doctor, an individual clinic, or an individual community, to then also take a step back and say, where else is this popping up? Is this just a really bad hospital? Or is this a really sad story for an individual? Or is there something systemic here? And then that's when you sort of go up to that other kind of source who can look at this systemically. So that's just, we don't need to do any exercises there, but that's just an idea of how to think about getting out there and starting to build the connections to folks when you're trying to investigate an issue orally, not just through the writing. Seema has a lot more experience with this recently. So I teach it, Seema does it. I haven't actually done this in the trenches for a number of years, but Seema's been doing this very recently. So over to you, Seema. Thoughts on reporting?
Yes, many thoughts on reporting. What would I say that's most relevant to this? I mean, it always starts with your network of sources is initially small when you start to establish yourself in a particular beat. And then, you know, a while later, you get to brag to editors about your deep sourcing and how big your network of sources is. And that's like those relationships that you carry with you when you move from news organization to news organization, and remembering to stay in touch with people. So you may have done a story about their science a year ago. Call them up, even if you think that there's nothing in the news about that, and ask them, so what are you working on? And even at the height of a crisis, there's room to do that in a way where somebody might be busy, they might be working on a COVID vaccine, but pick up the phone and say to them, what's the thing that you're doing or seeing that you're not reading about, that you're not seeing being covered? And they'll share with you a whole litany of frustrations about, well, this is happening and no one's writing about this, or there's this really interesting element of the vaccine development timeline that no one's asked me about. Ask people what they wish people asked them about their research. So that would be my main advice for this.
Great. Yeah, I think that's, I'm just still going through and see if there are any questions on any of this stuff. But I think that I think the key either way is just to do that thing that I think we now find really hard to do, which is to pick up the phone and speak to people. I'll say a very quick word about emailing. Emailing is good to establish contact. Emailing is not good to establish a relationship or to actually interview someone. When you email, you have no idea. First of all, you actually don't know who's answering. And particularly if you're trying to approach someone in a relatively senior position, they may not be the person who's answering the email. But the other thing is that you have no opportunity in an email really to engage on follow-up questions, to go down the rabbit holes that you need to go down in order to understand something more clearly. So, you know, a 10-minute conversation, and that's really all some of these need to be, a 5 or 10-minute conversation with someone on the phone. And, you know, even face-to-face, you know, at 2 meters, as we say in this country, apart, is more useful than an email, unless email's the only way in. Okay. Okay, I think that we're done there, and I'm watching the time, and I want to make sure we get to Q&A. Seema, should we just go to the writing structure thing and just wrap it up there with?
Yes, I think that would be really helpful to share.
Okay, so Jzona, there was a slide that says different goals also mean, I think it was before those. There you go. Yeah, perfect. Seema first saw this one, I think, when I was giving a talk at Rhodes House to a bunch of Rhodes scholars, and I was trying to, Seema happened to be at Oxford for a meeting, and I roped her in to inspire these folks. And it was a room full of scientists, social scientists, and humanists. And I was trying to explain to them how the structure of journalism is different. It takes the same pieces that you have, and I'll speak particularly the science and social science literature. I doubt that there are a lot of humanists on the call, but maybe there are. But it takes the same pieces and sort of like restructures them and puts different weights around them. So journalism writing is different, and it's written in order to grab people in a short period of time with the most significant part of the story. And what I would suggest as a structure is sort of on the right. But let's start off as a baseline, as a sort of benchmark, with the typical structure of a science or social science paper, right? You start with a question, there's a brief lit review. In the humanities, the lit review is often most of the paper, but there's a brief lit review. You then describe your method, you show your data, you show your conclusions, but your conclusions are very limited to the specific study and the specific methodology that you had. And then you have sometimes space for a bit more of a relaxed conversation, but areas for further study, very tentatively, because I'm a gastro and this starts to border on cardio. I'm thinking of the Vioxx stuff, and I really shouldn't go there too much. But this might be another area of for further study. In journalism, we take the same pieces and we actually sort of pull them around. I would actually, in a sense, take that thing that you end with, right? So the instinct for a scientist is to show your methodology first and then get into the conclusions. Every talk I've gone to is sort of like that. I actually want to take not just the conclusions, but the significance and throw that up to the top. It's not exactly the areas for further study, but it's the part where your brain goes when you're writing the areas for further study. When you're down there, you're like, how would this affect other folks, other fields? What's a really important, interesting question if I had a new grad student in my lab? That's the part that I want you to put up at the top, right? So you lead with the counterintuitive, most interesting piece out of this stuff. And then you go in a couple of, after the lead. The lead is actually very simple. The lead of a story is, here's what the most important piece is that you need to know about. Bang. And then you go into the stakes. Here's why it's important. That's what we call, in journalism, we call it a nut graph. Maybe a couple of paragraphs. And if you start to read with this slide in mind, you'll see the structures, particularly in longer features. This structure is sort of like this. Look for the part that says, this is why this is really important, right? This is why it's really important. It's not just about whether kids have, purple toes when they get COVID. What's really important is that this tells us we still don't understand how this works in kids, right? This is the stakes. This is how big the problem actually is. And then we can go into a little bit of background, right? Which is sort of the equivalent of the lit review, but it doesn't have to be a whole lot. It could just be enough to tell us, vaccines normally take 10 years to develop, or vaccine, there's more than one vaccine that people are out for, or there are 100 different vaccine trials going on now, whatever it may be. Just a bit of background to bring me up to speed if I happen to be a lawyer or an insurance salesperson who's reading this article, and I'm smart, but I don't know the background. And then the rest of it is just your high school essay. If you grew up in the kind of educational system that teaches, argument 1, argument 2, argument 3, that's very simple, right? Where you just break your insights down into some different pieces that you'll have reported. What I'd like to throw in there is a bit of a counter argument, right? That's a discipline we learned at the Journal, and it enabled us to take a nuanced view of things and to not go down the rabbit hole into something ideological. So point 1, point 2, to be sure, there are other legitimate views on this thing. People have also said this, but now we're getting back to that main point, right? Laying the structure out before you start calling people actually helps you identify the folks you need to call, because it will give you the laundry list. If you just lay out the structure and think of it as a set of questions you have to answer, it'll give you the laundry list of folks you actually need to call. So let me stop there and over to Seema for thoughts or reactions or telling me I'm totally wrong with this.
No, I find this framework really useful. And it goes back to what we were saying earlier about like storytelling being at the heart of a journalistic piece versus a grant application versus a conversation with the patient in the clinic, there are parallels. Of course, there are differences. The audience is different and it's a different context, but at the heart of it, you're thinking about how to structure a conversation, how to structure an argument. And I think one of the reasons sometimes sitting at the blank page and trying to write an 800-word piece or a 3,000-word piece is because you've done your reporting, you know what's at stake, you know the issues, you've done the interviews, but how do you structure this in a way that helps the reader go through this issue and then this tension and then this issue and then this tension? So while it's hard, it's also really satisfying. It also helps you organize your thoughts as you think about how best to structure a thesis, whether it's for humanities, a question for social science, or your lead for a journalistic piece.
So I think that we have I think 15 minutes left. We're right on schedule for Q&A and discussion.
Yeah, I think Rob and Seema, if you can just go ahead and go through the Q&A list and pick out those that you haven't already answered, either directly or tangentially, and try to address them in the next 14 or 15 minutes. And then the ones that we don't get to, perhaps we can answer later by written or during the next session a week from today. So
Yeah,
if you could just go through the list and pick out what you'd like to talk about.
Sure. So I have been answering some of them just by typing.
If I'm going to mispronounce it, Vianney. With something as catastrophic and unprecedented as COVID-19, how do we go about writing what-if stories? What are we missing? So as an example, will people get to opt out of voting in person, going to college, not online, et cetera, not based on fact, a bit more of a theoretical story. So the question is, there are all sorts of things are unknown. There are all sorts of what-if scenarios. How do you, I'm gathering, this is the question, how do you report that responsibly without just engaging in a lot of sort of fantasizing or catastrophizing? So I think that one of the things that we teach is that the journalistic process starts with the question, but it doesn't, you're not pitching or writing the question. You start with a question, and then the next thing is ask folks. So with something like this, I think these are entirely legitimate questions. There is actually a conversation going on now, I know in the United States, about how will elections actually happen, particularly after the Georgia primary. You know, and there are questions about the sustainability of online universities. So what do you do with that? You call the folks who are addressing it and ask them a little bit more precisely, how are you wrestling with this question right now? And that's how you turn the broad question into an actual set of facts. How are you wrestling with this right now? How are you planning for it? And if they say we're not planning for it, then the next question is, well, is that because you don't need to plan for it, like you're not worried, or why aren't you planning for it? And then you start to establish what's actually happening based on the open question that you had. And it's that piece that comes from the initial investigation. That's what you pitch. That's what you report on.
Rob, there's a great question here that I'd love to get your thoughts on. It's from Yalini Dream. And Yalini asks, how do journalists navigate an economic environment that affirms polarization versus new frameworks and alignment across differences?
I'm not quite sure I understand the question. So what do you understand for that? It sounds like a really important question, but I want to make sure I'm getting that. So Seema, what is it about that I wish Yalini could just elaborate on it, but I'll ask you because it stood out to you. So
it feels like the journalistic environment and the economic environment favors polarization. It makes for great stories. It's so sensationalist. Look, it's so binary. There's one side here and one side there. So what I'm understanding from Yalini's question is, if that's the favored framework, it feels like in many contexts, how do we navigate that as journalists who want to align across differences, who want to try new frameworks?
Yeah. I think that is a great question. And I have an answer that is maybe more based on faith and human observation than on, any method here. I actually think that polarization is exhausting to people. I think people on all sides of whatever a polarized issue is get tired, they get exhausted, they're weary. And I would say that is as true of people on the right as on the left. They're just tired. I don't want to keep, some people get off on it. I think most people are frustrated by it. And so I would actually suggest that if you can introduce the nuance that is well reported, that is reliable, people will actually gravitate to it. It may not be dramatic, it may not be sudden, which is why it has to be continual. Putting one thing out there is not going to do the trick, but being continually out there with thoughtful stuff starts to shift the consensus. If you are continually out there with thoughtful stuff that has evidence behind it, that starts to shift the consensus, right? We've seen it on one thing after another. I mean, there's a consensus in North America anyway that smoking is bad. That took a long time, right? But that came out after nuanced article after article, after studies, after research, right? You know, so it's possible, it may not be the best example, but it is possible to shift the consensus by just doing the work. Here's what I would say. The polarized stuff is easy to throw out there, but it's constantly playing catch up because, you know, it's ephemeral. It doesn't have roots in reality. People are constantly challenging it. So you constantly have to go back on TV and constantly defend yourself, and people burn out. But the real stuff, the slow stuff that picks up is just piece by piece by piece. We actually build up. Climate change is a better example, right? Climate change, there's a consensus now. Not everyone agrees, but there's a broad consensus that the climate is changing and that is bad. There's a pretty broad consensus on that. That took a long time to build. So I'd say do the work.
So what about this? That's a very hopeful answer, by the way. And I do agree with you. I think it can be, what's the word I'm looking for? Discouraging. When you keep seeing arguments represented as binary and you're trying to build past that. But I think what you're saying is there's an appetite for it and keep chipping away, keep doing it. And there's a question from Marina Trehan Martinez, and she's saying, what's the response when the raw data itself is called inaccurate? And then critics are ill-equipped with critical thinking capacity or experience in analyzing the data. So yes, we are seeing that right now in terms of so many armchair epidemiologists. I've had lots of unsavory thoughts about economists who are commenting on the epi data and making judgments based on it about contact tracing. There was even a Nobel Prize winning economist who was saying that contact tracing is just unnecessary. I was thinking, oh my gosh, no, it's not. You don't even understand what contact tracing is. For me, that affirms the need for good accountability and investigative journalism, because there are journalists out there who know how to show us that the data is inaccurate. And we saw that, Marina, about 2 weeks ago, I think, when there was some excellent reporting from the Atlantic and some other outlets who said, wait a minute, all of this testing data that the US government is putting forward is not what they're saying it is. It's a mishmash.
Serological
antibody, right, of serological data as well as viral PCR data. And in fact, they found this, even though the CDC website said our testing is only this one thing, and actually those reporters found it wasn't. So I share your concern that you have people that are ill-equipped with the skills to necessarily do that kind of analysis, and when the raw data itself is problematic. But then I have faith that even in that context, we've had some brilliant journalism under the crunch. As journalists are being furloughed and laid off, we've still seen Atlantic reporters and others be like, hey, everyone, testing capacity is not what you think it is. We've seen the same in the UK. And actually in the UK, when the British government was like, we've done this many tests, they were lying. And it was the BBC, Radio 4 was so good at calling it out and saying, they did this back and forth where one journalist said, how many tests has the UK government said they've done? And the other reporter would be like, they said this many. And then the other reporter would say, is that true? And they'd be like, no. They were like calling them out on it and saying, this is the actual number. They're including numbers of tests that have been mailed out, may not even get to the right person. So I have a lot of hope that when we give journalists the right tools and the right resources and the right support, that we get the answers the public needs to stay safe.
Yeah, we had a great example in Ontario. Ontario has 34 public health units, which is probably too many, quite chaotic compared to British Columbia, which managed this better and only has 6, smaller population, but anyway. But for months, the medical officer of health in the province was releasing numbers that were out of date by 2 or 3 days in terms of disease incidents. And the Toronto Star, simply by calling all 34 public health units every day and asking and looking at their websites and checking what they'd heard on the phone against the website, was getting more accurate data than the public health agency.
And you know, the same thing happened in the US, because suddenly the CDC website data went missing from it. And the CDC stopped doing what it's very good at doing, which is aggregating data across 50 states. Yeah. So what you had journalists doing at small outlets and large outlets was calling every single state and territory and getting that data for us. So I have faith in that.
I think to pull this together, there are two insights out of this. One is it reinforces this idea that journalists, good journalists, and there are a lot of good, serious journalists out there, are your allies, actually, right? So this notion of media training is anti-media training. Get that out of your mind. Good journalists are your allies and can actually get stuff out that is difficult for the actual agencies to get out because they're not subject to political pressure in the same way. And the other thing is that to be humble about the data, right? You are, as scientists, you look at data and you're humble, and everyone, on faculty wants to kick the tires on their colleague because, like, I'm not sure if this really works. Do the same, right? Don't be humble. If you're humble about the data, then we're less ideological. And the less ideological we are, the more we open a bridge to each other and the more we're able to depolarize the environment.
Right.
Yeah.
Yeah.
Sorry.
No, we have a few minutes left. Should we try one or two?
Yeah, for sure. You've been reading these more closely than me. I'm a little lost in all of them over here.
So here's a great question. It's about questioning the source. What do we do when there are news sources that we do trust, but then they make questionable, inaccurate, dangerous editorial and story decisions? That kind of rocks exactly what you said, right, just now.
You mean sources in terms of news sources or people?
Actual news sources.
So I'm reading the Times and the Times comes out with something crappy, right?
And you're like, oh my gosh.
Yeah. Well, yeah. So it's exactly, if I'm how many doctors make mistakes? How many doctors none, right? How many doctors misdiagnose something or suggest one course of action when actually another course of action would have been better? We don't abandon the physician. Never happens, right? We don't abandon the physician on the spot because of one thing that didn't work. We ask ourselves, is this physician serious? Did they own up to their mistake? Are they serious? Are they glib about this? Did they make it up the next day? Do I trust them on the basis of their whole record? And then I think, frankly, that's a larger social issue now where we're in such a cancel culture that if people make one mistake, if it's serious enough, we erase everything we want.
That's so extreme. I don't think people levy this whole cancel culture thing around as if it takes one error to get you canceled. I disagree with you on that. But I would say that to this point, to this question, we can do the same thing that we do with our sources. When we read a journal article and we're like, I have questions for you, or my interest is piqued by this, and we call them up. Let's do the same with journalists. And in fact, I wish that editors' bylines were included in news stories so that I could also hold the editor accountable for a headline decision or for a structural decision. I think we should contact journalists. You may not always get a response, unfortunately. I've written some complaining emails to some journalists recently about how they've interpreted data, but I think we should do that. We should let people know we engage with their work and we want to have a back and forth about it.
And if you recognize that every news article, every feature, even the best research ones are the first draft of history, right? To use that old saw. Of course, stuff is going to be wrong. Of course, stuff is going to... So there are a couple of things here. One, stuff will be wrong, right? They're just inevitably in the whole thing. So you have to have a sense of where this sits in the whole context of the way that they approach stories, the way that they approach news and journalism. The other thing is to be humble about your own perspective as a reader. It may be that it's actually not wrong. It may be that it just represents a perspective that isn't yours, and that they've spoken to people who aren't you. I'm not talking about you, Seema. I'm looking at you on the screen, but that, I spoke at one point with the chief of police of Toronto a while ago in a meeting who was going on and on about how, stories that are covering crime keep getting things wrong and wrong and wrong. I'm like, no, they don't, chief. They're not getting it wrong because I know how much work goes into it. They're just speaking to a bunch of folks who will never, ever speak to a cop, right? They're able to speak to folks, so they're getting a different kind of story. Yeah. So these are the questions to ask. And maybe they're getting something wrong, in which case contact them, absolutely. Try to set them right. It may be that they're not getting something wrong, they're just seeing it differently. It could be any of these things, but put it in the context of their seriousness. Gauge their seriousness as a whole.
And I think, with my journalism hat on, I work for you. I work for my audience member, whoever is reading or consuming or watching. So you want to hear from people when things land well and when they don't. So I think it's important, and that's part of building the relationship. So Rob, we have only 3 minutes left. I want to hand back to Dr. Barrack to help us wrap up. But I just want to say thank you to you. Thank you to Jay Zona, to Kurt, to Megan, to the entire CME team, to Dustine Schultz, our administrative assistant who helped make this go smoothly. Thank you to you. There's messages from people in India who are like, it's 1 a.m. and I didn't even realize what time it is. This is fascinating. So thank you for joining us. The recording will be available. Please share it widely so that folks can watch this before part 2, which is the same time next week. And we really hope to see you next week. Thank you, everyone. Stay safe.
Yeah, thanks, Seema and Rob. Terrific presentations. And thanks, Seema, for already thanking everybody.
I couldn't help
That's
it.
great. Appreciate it. And would reinforce that we look forward to having you all join us next week. We'll be sure to answer as many questions that you've already posed before then. And remember that next time we'll start with a little bit of a wrap up of what we covered today. And then go forward with that and give you an opportunity for even more questions and answers. So thank you all very much. During the midst of this pandemic, please stay safe, stay well, and we'll look forward to having you join us next week. Thank you very much.
Bye, everyone. Take care.